What is that?
Nah, no burgers, dog. No fries.
Excuse me.
No 4 for 4s, man.
What is it?
T-shirt from bar, man. You know what I'm saying?
Brian, are we on? Okay.
Wow.
All right. We're going to get started. I call this meeting back to order.
Oh, he go hard. He go hard.
Councilor Bellamy.
You. All right. My apologies, Madam Mayor.
Mr. Blair, do we need to amend the agenda if we're going to have the Social Services Advisory Board report before the?
Yes, Madam Mayor. I think you could do that by consent of council if you wish.
Okay.
Just by a nod?
Yes.
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 Fine with that.
Okay. So next up, we have the Social Services Advisory Board Annual Report.
Good evening. My name is Christine Goff. I live at 599 Bailey Road, and I am the chair of the Charlottesville Department of Social Services Advisory Board. We are pleased to present our annual report this year to City Council. I'd just like to remind you all, the City of Charlottesville's vision is to be one community filled with opportunity. The mission is to provide services that promote equity and an excellent quality of life in our community. The city's strategic plan goals that align with social services are goal number 1, an inclusive community of self-sufficient residents, goal 2, a healthy and safe city, and goal 5, a well-managed and responsive organization. And before I go any further, I would like to recognize Councilman Signer. It was a pleasure to serve with you for the last couple of years on the advisory board. I know that was one of the boards that you were appointed to is coming on to City Council, and I'd like to thank you for your expertise and your knowledge and your support in all of our monthly meetings.
Thank you. That means a lot. It was really nice to serve with you guys.
Thank you. Thank you. So in this year's report, the advisory board chose to focus on Medicaid expansion, the Joint Legislative Adult Audit and Review Commission, also known as JLARC, and the University of Virginia's Charlottesville Child Welfare Studies and the department's ongoing cultural humility training. So some of the programs, but certainly not all of the programs that we oversee with social services are child care assistance, TANF, Medicaid, adult protective services, child protective services, family engagement, adoption, SNAP, VIEW, FAMOUS, adult services, foster care prevention, foster care, and fostering futures. So obviously on January of this year, Medicaid expansion came into play. You can see that in fiscal year 2014, we had 343 Medicaid applications received in the second quarter of the fiscal year. In 2015, that jumped up to 433. In 2016, we kind of slid down to 412. 2017, we rose to 458, and in fiscal year 2018, we rose up to 903. Medicaid expansion was a really healthy program in our locality. After 1 year of Medicaid expansion and working with community partners, the department's annual Medicaid enrollment increased from 1,052 to 1,727 families and individuals being served. Many vulnerable populations now have health insurance and health care options through various managed care programs. A few of these clients needed medically complex care such as in-home care and nursing home care, and now have become eligible for Medicaid covered services until they are 65 or become Medicare eligible. The agency has faced some challenges during this period. There has been a 50% increase in ongoing Medicaid renewal work. However, the positive results in our community far outweigh the increase in work. Many homeless are now receiving medical support such as prescription coverage and cancer screenings. An individual who had lived in a tent with medically complex issues is now housed and receiving needed medical care. Medicaid for adults has also helped underemployed families who are now eligible for medical coverage. This coverage has no enrollment costs or monthly premiums for individuals between the ages of 19 and 64 who meet the eligibility qualification and are within the income guidelines. For many in our community, this is the first time that they've had comprehensive health care coverage. Anybody is welcome to apply for the Medicaid expansion program. They can come by the office to apply, or they can apply online at Common Help. Some other challenges that we have encountered is all enrollments that are under the fast track will be due for renewal became due for renewal starting in October. Clients will need to complete a paper or online renewal form for continued coverage. The backlog of applications from the federally facilitated marketplace, or Cover Virginia, sent to localities are coming due or are already overdue. Duplicate and incorrectly enrolled cases into Medicaid through automation will need to be corrected at renewal, which may end as a closure to coverage. So the Charlottesville Department of Social Services was highlighted in the JLARC, which is the Joint Legislative Audit and Review Commission report. As of March of 2018, Charlottesville placed 33% of the children in foster care with relatives compared to a 6% statewide trend. In 2017, the Joint Legislative Audit and Review Commission directed staff to study the foster care and adoption services delivered by Virginia's local departments of social services and supervised by the Virginia Department of Social Services. As a part of that study, JLARC staff came to the Charlottesville Department of Social Services to discuss how the agency achieves the high percentages of foster care children placed in foster families, the high percentage of kinship placements, and the low percentage in congregate care placements or group homes or residential facilities. The JLARC December 2018 report to the governor and to the General Assembly of Virginia noted the following. Again, as of March 2018, Charlottesville had placed 33% of children in foster care with relatives compared to 6% nationwide. And Charlottesville and also the city of Hampton attribute their low use of congregate care to their focus on recruiting foster families that meet the individual needs of children in their care. The complete JLARC study can be found online. And just a couple of other bullet points that I'd like to highlight. 36% of the children in foster care live in kinship homes with relatives. 14% of children in foster care in this area live in non-blood related fictive kin homes. 45% of children in foster care live in non-relative foster families, and only 5% are living in congregate care facilities. The University of Virginia also did a study on the Charlottesville child welfare. Two research studies were done in a partnership with the Virginia Department of Social Services and the Public Interest Data Lab, a project at the University of Virginia Library, the Frank Batten School of Leadership and Public Policy, and the Community Policy, Analytics, and Strategy Lab. The research focused on racial disproportionality, which is overrepresentation of racial groups in the child welfare system relative to their presence in the population, and racial disparity, which is differences in outcomes for some racial groups compared to others at multiple states of interaction within the child welfare system. The research is limited by the relatively small number of child welfare involved children in Charlottesville. In some cases, statistical modeling was used to determine outcomes. It is also important to note that race is generally a subjective determination, which is especially important to consider when reviewing the findings concerning multiracial children. The findings of the study include Black and multiracial children were referred to CPS at twice the rate of their population percentage. There are no discernible differences by race in whether Child Protective Service cases were substantiated and at what level. There are no discernible differences in overall time in foster care between Black and white children. And the most common reasons children enter foster care are neglect, parental drug use, and inadequate housing. Our department had responses to the studies. We chose to provide training for staff and community partners on implicit bias, cultural humility, behavioral descriptive language, institutional racism, strategies to have conversations about race and privilege, and the history of race and racism in Charlottesville. To improve collaboration between the employment service team and the child welfare teams to support household income and asset growth. To establish a method for blind referral assignment in Child Protective Services, and to use family finding strategies to increase participation in the CPS case to build in family supports. One of the greatest things that I think that our agency has done this year is Diane Kukno, who is our director, created a requirement for cultural humility training. The Charlottesville Department of Social Services is committed to cultural humility. We believe that individuals and families are experts on their own culture and background. We engage with each other and with the community to serve with a core belief that we learn from each other and commit to the organizational values of respect, excellence, creativity, trust, and leadership. In a handout, in an email that was sent out to all staff, effective July 1st, social service employees are asked to complete a minimum of 12 hours of cultural humility awareness and training per year. The following statement was sent to all current employees and was added to the training materials for new staff. We believe in an equitable and inclusive workplace culture where every employee experiences trust and respect, is treated with dignity, and feels engaged and confident to perform well. We have a shared commitment to develop our cultural humility through training, development, coaching, and mentoring. Cultural humility is an ongoing development process that includes an acquired understanding of the patterns and potential dynamics of specific groups and cultures, including our own. It is the understanding of how culture, the values, beliefs, attitudes, traditions acquired from affiliate groups, as well as personal circumstances, conditions, nature, and experience influence our own and other people's thinkings and behaviors. The advisory board strongly supports this ongoing professional development for department staff. Are there any questions or comments?
And that was at 12 hours, was it 12 hours a year? So I didn't get a chance to read the entire report, but just wondering what recommendations did they make for any of the concerns that they had?
What recommendations who made?
Were made in the report that was done during the audit?
The report that was done during the audit.
Were there any recommendations in that report? I haven't.
With the JLARC audit?
They actually came to us because we had such a high number of children that were in kinship placements. I'm sorry. The JLARC group came to us wondering how we had such a high number of children in kinship placements. And so, we described our processes where as soon as a child is going to have to come into care, we are searching for kin. And we begin with biological parents or grandparents or the custodial person in that child's life, and we reach out to extended family members. And as we said, some are fictive kin, which doesn't mean that they're biological relations, but they may be called aunt, or they may be a neighbor that is very close to the child or children. And we do our family partnership meetings where people come together and say what they can do to wrap their arms around this family and provide supports. Because even with kinship placements, you know, our number one goal is return children home, if at all possible. And many children do go home. Not all do. Some are adopted or custody is transferred to relatives, and then sometimes there's adoption that's non-relative. But the JLARC report highlighted us and Hampton, City of Hampton, as the two localities in the state that are really on the forefront of understanding that it's much less traumatic for children if they have to be removed from their biological parent or parents to be with kin and to be with people that they know. And so, you know, that's a really high priority of ours.
The other question that I had in terms of referral reporters,
Yes.
do you know the percentage in that other category? Because it was 24%.
Yeah, so the other category of 24%.
I was just wondering how many of those are government agency employees. Did you have that breakdown?
Well, we have law enforcement breakdown, as you'll see, schools, educational personnel. Now, most of those are the public schools. There are very few that come from the private schools, but and then social services personnel is not just social services. It could be anybody that has social work backgrounds would be in that social services personnel stuff. And then mental health, parent, other relatives, friends, neighbor. Anonymous, of course, are people can make a report without saying who they are. And, you know, we have a whole form. It's a differential response system that we have to follow, and that's a state form, and it's followed across the state to decide whether it's a valid report or if it's invalid. And I will say there are more invalid reports. You know, there might be something going on, but it doesn't rise to us doing an assessment or a higher level investigation. And so that other could be ministers, child care providers. So there's a lot of different things that go into the other.
Okay.
It's,
Just at the bottom, it said government agency employees, and I was just interested, especially since we're talking.
well, I mean, that could be state agency
Okay.
employees. It
That's
could be
that was my
local.
question.
It could be federal employees, but they'd all be considered government employees. That
So
could
you
be-
wouldn't know how many come from, like, within the city?
No,
Okay.
except for even the law enforcement, that could be state police.
Yeah.
I mean, we really aren't tracking it at that level. We
Okay.
track it by what the state is tracking, so.
And the inadequate housing is one of the areas
Yes.
that,
Yeah.
how many kids are eventually able to be returned home if that's because it's not necessarily normally that there's any neglect, it's just that parents are unable to provide stable
The housing, yeah. And so that's the neglect there is inability. But we work really closely, and like I said, we're trying to work more closely with our VIEW team, which is the Virginia Initiative for Employment, Not Welfare, in trying to increase parents that have children in foster care, their skills, their education levels, so that they can get a better paying job. Than many of them are at minimum wage or just above minimum wage. And so it's not always that they're not working, but you know, who in this community can live off a minimum wage if you have one child? That you can't. And then if you look and counter into that child care and housing, and so yes, housing is a problem. The cost of housing is a problem, and along with drug use and domestic violence, I mean, those are really top of our reports that come in. But the vast majority, again, is not abuse. It's neglect, and the neglect falls into the adequate housing or the inadequate supervision, which, you know, if you can't afford childcare, you have children that are home at a very young age that shouldn't be left alone, that kind of stuff. So, yeah, so a lot of it has to do with low income, poverty.
And so is the training that you all are started this year and want to continue, and there was something else, and there was a blind report or
Oh,
something?
blind referral. So
Okay.
what we're doing with that, this was, I can't remember what state we got this idea from, but it was not the state of Virginia, but it was another place in the country. What they do with their CPS referrals, so these are the reports that come in, once it's decided whether it's a valid referral or not, it gets passed on to 3 people. There are no names attached to the referral. There's no address attached to the referral. There's no race attached to the referral. Now, all of those things have to be taken down when we're getting a referral, but the people deciding whether it's going to be an assessment or an investigation don't have any of that information. So we want to make sure that it's not being biased against poor people, against people that are minorities, but we're only doing that 2 days a month because we don't have enough staffing to put 3 people on each referral. We currently have 1 intake worker who's doing all the referral work, but 2 days a month. So we've just started this in the spring, so we don't have enough data yet to see if that's making a difference, but we're hoping within, by next summer or so, we'll have enough data to see if that makes a difference.
Yeah, I'm interested. That's what I.
Excuse me?
What's the salary of an intake worker?
Well, it depends upon their qualifications, so
Yeah.
the 1 intake worker we have now, I would have to look at his salary, current salary, and
Because I mean, one
I don't
intake
know.
worker for all these cases is ridiculous.
Yeah.
Not saying it's your fault or y'all's fault. I'm just saying. I mean,
Yeah.
we look at
Well,
budgetary
and the
priorities,
intake
that's-
worker is working, 8 to 5, but then we have somebody on call, rotating on call, that has to do that the rest of the hours. But-
Still nowhere near enough.
Yeah.
To be able to address these issues adequately.
So I just have a question.
Yes.
The team of 3 people that the
Right.
cases are referred
Yes.
to. I was making a point, please, Dr. Bellamy. So the training and then the blind referral process, what you're hoping to see maybe is the reduction in the
That's
number
what we're-
of cases
That's what we're hoping,
that are
that
referred.
there's, the disparity is going to go down. That's our hope.
Okay.
And
So these are just.
this cultural humility, cultural, development is 12 hours for the year, but that's going to be ongoing. It's not like we're going to end it next July 1. It's going to be an ongoing. And it's very interesting. A lot of staff have already gone well past the 12 hours of training. And we've had a lot of opportunities for training. And there are teams that are finding opportunities for their team to do the training together. But it's been embraced. I would say it's been embraced. I'm not going to say by 100% of our staff. I'm not going to. I would say by 90 to 95% of our staff have embraced it. And we have a few people that are, holding on, saying, I don't understand why we have to do this kind of thing. And they, they're coming along.
Can you, Madam Mayor? Thank you for the comprehensiveness of the presentation. It really was. It's been great being on the board, and I think that you can see how hard you all are trying to keep pace or move ahead. The equity lens focus of the city, and how hard we're trying across the board to do this. And I think you really see evidence of that in the approach that you're taking. I wanted to ask about the Medicaid expansion because it's so dramatic, and I remember that when these figures started coming through, it was like this was real human effects of that change
Yes.
in Virginia. And I just am curious, kind of anecdotally, double the number of people are now directly interacting
And
with
it's so
this
interesting.
and federal funds, and I'm curious about how are we handling it? What's the relationship with the community like? Is it appreciated? I mean, I'm not sure
You know,
exactly what I want to ask, but I'm curious about
yeah.
when you double the effect of
We're
a,
not-
of a
you know, we're
agency
not-
because
we're
this.
doing it because it's the right thing to do, so we're not
course.
really looking for
No,
appreciation.
of course.
But it's very interesting. There are people that, I'm talking about. Yeah.
I phrased that wrong. It
Yeah.
wasn't, I'm trying to understand how everybody was wanting this to happen for so long, and it doubled the capacity of the agency, but I'm curious about how the implementation of it has worked, basically.
Right, right. And a few of these cases, unfortunately, were approved inappropriately by the federal marketplace, or by the state has contract workers that did some of this. And when we talk about sometimes these things are overdue for renewal, it's because we don't get them from those two areas. So a few of these people are going to fall off, but it's going to be a small, very small percentage, because the renewals are coming up now. And Medicaid started January 1, but it's incredible to see the difference in health care for our homeless. It's really amazing. There's no more standing in line, hoping maybe you can get some meds, and we do. We have, UVA is a great facility as far as serving so many of our poor folks, but it's a whole difference when they're going to be getting Medicaid payment for the services that they're providing. They can go beyond what they used to do. And I'm not just speaking of our homeless. So many of our low income, especially adults, even if their children had qualified for FAMUS before, the adults didn't qualify for anything. Well, it's okay to have your children healthy, but what about your parents? You need your parents healthy if you're a child. And people getting just common things like controlling their diabetes, and then more serious things, getting their mammograms done and discovering cancer earlier, and those kinds of things where they're not worrying about, I have no way to pay for this, so I don't want to know. It's really been and long overdue in the state of Virginia, but we're so grateful that it's here.
Yeah.
So
Okay,
grateful
thanks.
that it's here. And it has increased, our caseload greatly. So,
Right.
one of our requests last year that didn't get approved in the budget was another benefit program supervisor. And that's back again in our request for a budget adjustment this year. So we
So
got.
you haven't had any increased staff with the double?
We got from the state last year,
Okay.
year to enough funding for 2 new benefit workers, but we didn't have enough for another supervisor.
Wow.
So,
Okay.
yes.
Mayor Walker, I do have one question.
Yeah, I have one more.
Okay.
I didn't see.
Oh, okay. So,
You go. No, you go.
The,
no,
um,
you go.
I remember back in 2013 when we did the Growing Opportunity Report, and we were focusing on the VIEW program, and the idea was to raise the wages of our clients in the VIEW program. However, there was that cliff that was reached
Yes, where
when they
lose
go over
benefits.
a certain income level, they lose all of their daycare, childcare benefits. Has that been fixed? Is that still the problem?
That has not been fixed.
Oh, dear.
However, if they're in the VIEW program, there is a time frame before they lose those benefits, but no, that has not been fixed. The good thing is that the city and the county contribute to United Way child care, and they have a higher, so if our people fall off the 150% of poverty thing, they can go and apply. And
Okay.
again, there's city funds in that and county funds,
Okay.
and they can go to United Way to, bridge that gap, at least until they're well over 200%.
And has that been adequate, or is that?
I don't know that it's been adequate.
Okay.
No, it's not.
Excuse me?
I was answering.
You said
That it's not.
It's not, yeah. I wasn't going to say that's adequate, but it's, it's kind of a bridge
better,
gap.
yeah.
But,
Okay.
once they're earning 200% of the poverty level, then they fall off the subsidy.
Because I don't ever remember
And that's
seeing that
still
come
like
back.
based on household size, but it still could be what, how much is that? It's like in the 40, maybe 40,000
Yeah,
or so, so
something
it's
like
not
that.
that high.
Yeah. And when you consider the cost of housing, what people are paying for housing, it
So I
gets.
guess has United Way been providing us with requests for more increases in this area? I don't remember seeing that. Anyway, this is something for the budget cycle
Yeah.
again, but,
And, yeah, the thing that really helps, I'll say this as a former single parent, really helps is when children go to school and they can just have after-school care,
Yeah.
which is very helpful.
helpful.
But I say just have after-school care, but that's, only 9 months out of the year too, so.
thank you.
So just one more question for me. The question on the continue to study section, that is the way race is captured in the data valid, what, I was a little bit more context around
Yeah,
that
well,
question.
things like our CPS reports, when we're asking for race, what somebody who's reporting may consider multiracial may not be multiracial. And so, it's most difficult in that multiracial category. So then sometimes when we're serving a family, we'll change that when they tell us what their race is. But, so.
Okay.
I think through this process, most of the questions that I have been addressed at this point. But thank you very much I did have a few questions, but they have been, it was around the inadequate housing, the definition of fictive kin homes, which is helpful to understand. I guess the only thing, just because I really appreciated that flow chart of just how
Oh,
these
yes,
things
so
are.
the decision,
Our process. I'm just trying to get a sense for how long that process takes.
Oh, it does not take very long at all. I mean, this comes into,
So when something is reported and then once you verify
Right.
that there is an issue to be followed up on.
Right.
Versus like days.
right. And so what it is that, no, it's not days.
Hours?
Yeah, hours.
Okay.
It's hours.
Okay,
It
that's what I was
goes
trying to get a
down.
sense for,
It
like-
goes down. And then the days that we're doing the 3 people making the decisions, it gets stuck at that point until the 3 people get together and make the decision. But it's not. And we have response times for our cases. Like any report of a child under a certain age, we have to respond within 24 hours.
Okay.
And similarly, like there's even the most low-level response has to be done within 48, 72 hours. We don't have time to twiddle our thumbs and
Right.
think about it. So, no, that differential response, it goes through that, but it's kind of in everybody's mind how that referral process goes, and that's rather quickly.
I just found this a very helpful guide, and I was just trying to get a sense for timeline.
Yeah,
Thank you.
it's very quick. It's very quick when the decisions are made, whether it's valid or not, and then the decisions whether it's going to be an assessment or whether it's going to be an investigation. Now, mind you, if we get 3 valid reports on a family in 1 year, it has to be an assessment. We can't do, it has to be an investigation. We can't do an assessment if we get 3 valid reports on a family in 1 year. So.
And you've defined this non-blood related fictive kin homes. Is there what thought is given to matching children up with a family of their own race?
We attempt to do that. A lot of our foster families, we have more white foster families, and most of the foster families we use are CAF families. And so always possible. That's what we want to happen. Again, because of the cultural stuff, that's important for them to keep their cultural identity too. So it doesn't always happen, but that's our hope.
Yeah, before I actually understood what that one phrase meant, I thought maybe
The
that was
fictive
what it
kin?
was.
Yeah. No, fictive kin is people that children
They know.
already know. Yeah,
Thank you.
sure. Wes, did you have?
They've asked the 30 questions that I had. I love my colleagues. No, but in all seriousness, and I kind of touched on it a little bit, I'm rather perplexed with the amount of help that's still needed. And I do think that when we're looking at budgetary requests and things of that nature from a wide variety of different departments, when we look at the human element in terms of the need that's still there from serving what may arguably be our most vulnerable population, I think there is a strong argument for new positions and full-time equivalent positions, FTEs as we call them, in the social services department. While there are several competing needs and factors, as we heard during public comment, and different budgetary requests and different pots of money that can be used, when we think about the most basic element of children and the human need through social services, it has to be a priority. I probably won't be able to address as much as my time is coming to an end on council, but I see with our 3 new counselors still in the room, I hope that, knowing them how I know them, I know this will be, but I hope and pray that all of you can push this up to the front of our budgetary needs. Because to think about a child who was in need and who is often compared when we look at budgetary requests to other items, it's just not fair. I don't really want to go too much into it, but I'll just leave it there. Thank you all for your work.
Well, and I wanted to say also, when our administrative positions, if we get another position personnel, there is 30 to 32% match from the federal government, so it's not 100% city funding. And the other thing is, I mean, we didn't put this on the slides, but I hope you also looked at the reports, how much money is brought into the city in federal and state funds, $87 million, which the highest amount of that is Medicaid. But then also, you know, we go Medicaid and SNAP and all of our benefit programs, but then another healthy chunk of change is for our family services also. So, but I think it's important to understand that those funds coming into the city, you know, are cycling through the city a number of times. You know, it's paying rent, it's paying medical providers, it's paying, you know, it's buying groceries and gas and, you know, so I do want to make sure that we understand that it's not just handouts, but it's benefiting the community also a number of times over as that money gets spent and respent.
Which people forget a lot of times.
Yes.
But, you know, I understand, having been in the field and worked in the field, when we're talking about equity and eliminating, you know, discrepancies based on staff referrals and things like that, to do that work, you're going to need staff members to not be taxed and stressed, because it limits their ability to make decisions that are best.
Right.
You're tired, you're stressed out, you're overworked,
Yeah.
your caseload is high. So all of those things, yes. No, I know you were agreeing with me. No, I'm not talking about you. Talking about this.
You stressed right now, ain't it, Dr. Richardson? I'm stressed.
So that is just really important. And I know the brief time that I was on the advisory board, really brief, but
we did appreciate it. Okay?
but we were talking about these staff positions, some of them a year ago.
Yes, yeah, and none of
And
those got
so-
approved, but now, you know, we've got 3 more that we have
Yeah.
out there that.
So it's just important, especially if you're going to talk about that work being able to impact how families enter the system, how they're treated once they're there, and if they get the best care.
Well, thank you very
I
much.
just want to acknowledge too that, you know, that's the statistic, that 33% of the children are in foster care are with relatives, compared to the 6% Virginia-wide, is something that we're grateful for your efforts, given that you are understaffed and that you've managed to hit that kind of a benchmark with only one other city in the Commonwealth. So thank you.
Yeah, and it actually has gone up slightly. In the written report, we put the October 10th, 2019. And so kinship homes went up to 36%. And so, yeah, so, you know, we're working on that. Again, it's much less traumatic for a child to go to a home that they already know the people and the blood relations. They're, you know, we're human beings. Blood relations matter. And so, anyways, we feel very strongly about that, and we work really hard.
I feel the need to make one more comment about this because we have to still focus on just healthy, you know, making sure that our families are as healthy as possible to keep their own kids when they can, and that kids are returned home, because I've been in this situation twice, as you know, too, and no matter how great you are with the children, they usually want to
They
be
wanna
back
go
with
home.
their families, and the community that we can create to make sure that that is possible is ideal. Because even if you're with somebody you know, if you want your parent or parents, you want them, and
Well,
that's.
and you know, that's when we talk about trauma-informed care, you know, being removed from your parent or parents or whoever you knew as your parents, because sometimes people come home from the hospital to grandma and they consider
Yeah.
that mom, you know,
Yeah.
whoever that is a childhood trauma that
Yeah.
follows people as they go forward in life. So,
Yeah.
you know, our hope is to keep people together as much as possible, and we provide a lot. You know, we have a huge foster care prevention team, which is really family preservation and trying to do wraparound services. And again, that's one of the things that we do, and thankfully the city, you know, is supporting it with the match we need for that funding. But we do that a lot more than a lot of other localities, so.
Thank you.
Thank you.
you.
That's yours, yeah. Thank you, Chrissy. Yes, thank you.
No, I gotta go home. I'm leaving at 11. We all gonna.
So next up, we have, what do we have? The Charlottesville Redevelopment and Housing Authority update. And following that report, it will be the Ting Internet update for public housing. And so we'll be able to ask questions on them at the same, back-to-back, same time. Just want to make sure.
Cause we know you have some. Cause we know you're gonna have several.
I'll start. I'm
don't have
Betsy
it marked
Rutger.
up.
I'm the chair of the CRHA board, and I'm kind of just introducing Grant Duffield. But also just wanted to point out the importance of, I mean, I think we had the presentation previously that was of ultra importance, but the importance of CRHA in this community and trying to support it as much as we can. I think most people know public housing in the United States started in 1937 and didn't come to Charlottesville until 1965 when West Haven was built, but it all started on a very rocky foundation in Charlottesville as Vinegar Hill was taken down with urban renewal. And many of those residents were moved into West Haven. So I think the beginning of public housing in this city has sort of made maybe working here in Charlottesville and that even more difficult. And so we're trying very hard to kind of keep what we have, which is the land given at that time, and do the best we can with it and serve as many residents as we can. With that, our executive director, Grant Duffield, will present, and he is actually leaving us at the end of the week, so we wanted to give him a thank you for 3.5 years of service.
Thank you, Mr. Duffield.
And also Wes Bellamy will be leaving our board as
yeah.
the council representative, so thank you.
Thank you. Out of here.
Grant, that felt like, you know, like, yes.
That's not
Wes not
true.
causing, no, it's Wes causing problems.
Exactly.
You know that, right? Okay. How are you?
I'm well, thank you. As Mayor, members of council, thank you for having us before you this evening. Before I get started in the sort of presentation proper, I need to say thank you. Thank you to this council for the work that you've done, the vision that you provided to this community around the issues of affordable and low-income housing. I recognize very much that there is a partnership that exists between the City of Charlottesville, the Charlottesville Redevelopment and Housing Authority, our Public Housing Association of Residents. And yeah, partnerships can be trying, and they are challenging at times, but they're based on the common knowledge that there are shared values and shared desired outcomes, and that the skills, talents, the assets that each partner brings makes achievement of those goals and common values possible. Thank you for your partnership, and thank you for your work.
Thank you.
All right. So let me navigate. Brian said all I'd have, oh, there we go. Just an overview of what we'll cover this evening. We'll talk a few minutes about who we serve. I'll spend a few minutes going over sort of an occupancy review as well as the fiscal status of CRHA. Take a little deeper dive into the Charlottesville Supplemental Rental Assistance Program. We'll talk about our redevelopment efforts and share some of the key milestones around those, particularly Crescent Halls, South First Street Phase 1, South First Street Phase 2. Spend some time sharing with you the sustainability study that I know Council's interested in seeing from CRHA, our Section 3 program development concepts, and then a strategic outlook that sort of focuses on our future redevelopment efforts, among other items. Transition planning as we move into the next phase for CRHA. Who we serve. We have 376 total apartment units under management. We are currently serving 336 households, just over 1,000 persons total. This is how our housing units currently break out. One-person households, 149, two-person 54, three-person 58, four-person 30, five-person 20, and 6+, we have 25 families of 6 people or greater. We have under 18 population, 551, a disabled population, 163, those receiving SSI or similar assistance, 186. Female head of households, of our 336, 238 of them are female head of households. And across CRHA, our average annual income for our residents is somewhere around $13,000 a year. These are the numbers just on the public housing side. In addition to this, we also help provide assistance to 340 HCV clients and families in the Charlottesville area. We're in the middle of a lease up with HCV, and we have another 40 that will be added to the rolls.
Can you explain that acronym?
Thank you very much. I appreciate that, yeah. Housing Choice Voucher recipients, formerly Section 8 housing recipients. As far as our occupancy numbers, here's a look at vacancies by neighborhood. We look at Crescent Halls. We have a total of 105 units in Crescent Halls. Currently, we have 13 that are vacant. Those 13 are being sort of held out for our redevelopment efforts. As we'll talk shortly, we're going to need those vacancies so that we can house people in place during the redevelopment process. In West Haven, we also have 13 vacancies out of the 126 units there. Of those 13, we have 3 that are HUD-approved offline units. We have 3 that are in the process of lease-up. When we say lease-up, we typically think that's anywhere from 2 to 3 weeks before we'll have a family in that apartment. When the lease-up process is underway, we've identified an eligible family, made an offer, they accepted. now it's time just for the logistics to get those families into the units. So for West Haven, we have sort of an effective net vacancy of 7 units at this time. South First Street, 58 units, 3 of which are vacant. All 3 of those are in the lease-up process. 6th Street, we have 25 total units, 3 vacancies. 2 are in the lease-up process, leaving us with 1 net vacancy. And then all other sites, 62 units, 8 of those are vacant, 1 in the lease-up process, 7 net vacancies on the CRHA books. So I think that gives you a sense of how things shake out on the occupancy piece. Yes?
I'm just curious, because I've asked for this before. Is there a way just to see over time, like how long units have been offline and the number of units offline, and not just a current snapshot? I'm just
Okay.
trying to understand what data is available to understand that.
So if, are we asking for offline units, or are we asking for units that have remained vacant for a period of time?
Those are two different
There's
things.
a different.
I'd be
yeah.
curious to understand both.
So I
Okay.
think one thing that we could do, Mr. Duffield, is we can get Ms. Claudette as you're soon leaving. Excuse me? One thing that we can do, Mr. Duffield, from my lovely Aunt Joy in the back, we can get Ms. Claudette to provide maybe a month-by-month snapshot, which is essentially what Mr. Duffield provides to us at the Housing Authority meetings. And then you'll be able to see the trend in regards, if we started maybe in January, you would be able to see the trend in terms of vacancies as well as units that were offline. But I think it's also clear, as Mr. Duffield is going to break down later, the reasons why units are offline, especially for extended time. Some of these units require extensive work, and I think those aren't things that you get from a snapshot. Does that answer? Is that adequate for you?
Yeah, it's helpful to understand on a unit by unit basis how long has a unit been offline for. A year? Has it been a month? And I don't know that you'll get that if you just look at monthly snapshots. It's just to see the longevity of those that are. I mean, for those that you're saying are offline, I think it would be easy just to show how long that unit has been offline.
But can he finish the report
Yeah, I'm
before
sorry.
we ask questions? Thank you.
You got your own
Thanks. Let's see. So, from an agency fiscal standpoint, overview here, our fiscal year runs from April 1st to March 31st every year. Our annual revenue is $7.8 million. Our annual expenses, we budget in at $7.7 million. And let's see, this is how our expenses break out on an annual basis. Our HCV, Housing Choice Voucher payments, a little over $3 million a year. Maintenance and capital is the next highest expenditure at almost $1.9 million. We have security services for $120,000. Our utilities to the city are $524,000. Utilities other are $293,000. Administrative costs for both public housing and our Housing Choice Voucher program is $1.5 million, and then other insurance, pilot, things of that nature make up the difference there. So, let's see. Taking a look at our Charlottesville Supplemental Rental Assistance Program, the CSRAP program. We currently have 100 families enrolled. We are bringing another 8 families in to the program actually tomorrow. So we'll have 108 very shortly. Currently serving 91 of those 100 means that we've got 100 families in, 91 have secured housing and are receiving benefits. The other 9 are in the search process for housing. So they're enrolled in the program, but they haven't obtained housing as of yet. A breakdown of the numbers here for our CSRAP. It's part of our agreement with the city of Charlottesville to administer the CSRAP program, we had certain tiers established, minimum tiers established. We set self-sufficiency with a minimum tier of serving at least 40 families, homeless at least 15 families, and then the balance that aren't served from those two sources could be served from the HCV waiting list, the CRHA Housing Choice Voucher waiting list. So of self-sufficiency, we had the 40 minimum. We're currently serving 42. We don't have any families who are on a self-sufficiency program who are searching for housing or enrolled in the program. So at the moment, we're tiered at 42. Our homeless, we had a minimum requirement of 15. We have enrolled 32 families in the program. Of those, let's see, we have 9 who are pending housing, obtaining housing. They're in the searching process. So we're serving 41 at this point total. 32 have actually received housing. Another 9 are searching. So our CRHA waiting list, there isn't a minimum. That's why we have an asterisk there. That minimum sort of fluctuates based on the number or the amount of funding that's available. We've served 17 individuals or 17 families from our waiting list. We don't have any that are currently enrolled and looking there. So of our current 100, 91, again, currently housed, non-searching. We anticipate, let's see, that's my next, we would anticipate, based on where we are in the budget process, we would anticipate serving 119 families would cap us out at just about the allocation of $945,000 that the city has set for us. So, we will pick up an additional 11 families here in the next month to bring us to that 119 threshold and generate that annual project spend. As part of the agreement that we have with the city, there is a set aside in place to help cover unexpected expenditures if rents fluctuate, if the status of employment of families change within the program. A little more on CSRAP. 91 total families served. 163 kids are being housed because of the program. Of those, 60 are under the age of 5. Elderly and disabled persons, we have 26 that are being served. 125 adults. 71% of our participants live within the city. The other 29% don't live in the city, but they do work in the city. So that's how the CSRAP program breaks down at this point.
Just told no more questions.
Okay. Take just a minute and share with you a little bit around resident-led redevelopment. And I can't start without, again, saying thank you to council. Of the achievements and things that we'll talk about for a few minutes here, none at all would be possible without your support. Certainly, we've been awarded low-income housing tax credits. Each one of those applications is entirely predicated on city's investment in the projects to begin with it. So without your seed capital, those credits wouldn't be available to us, and the funding to do redevelopment wouldn't happen. Thank you. The first project is obviously Crescent Halls. We anticipate construction of Crescent Halls beginning in March. We've got our final construction drawings underway. Our general contractor's here. I'll ask him to come forward in a moment, and Well, you can come forward if you'd like, right? So we are engaged in a floor-by-floor renovation process. Total funding for the project is $17.6 million, and that includes the 1.8 million, 1.875 million that the city has committed from its CIP. Our resident engagement continues to move forward, now at this point largely around relocation planning. One of the most exciting pieces, or an interesting piece anyway, is we'll actually have a mock-up unit built into Crescent Halls next month to feature what the future units will look like, and let residents provide us with some feedback about what they like and where we can make some improvements. With that, I'm going to turn it over to Cornelius Griggs, our general contractor, who can talk a little bit more about the redevelopment process at Crescent Halls.
Thank you, Grant. Good evening. I'm Cornelius Griggs. I'm the president and CEO of GMA Construction Group, and we are excited to be here in Charlottesville taking part in the renovation and restoration of Crescent Hall. We're also participating in the new construction of the 62 units that are going to go up at the South First Street site as well on phase 1. So currently we are in the design document phase. We're expecting to have a set of pricing documents on Crescent Hall released in the first part of December with a plan of having a guaranteed maximum price budget back to the Housing Authority and the development team by the end of December. We're expecting to have a pricing document for our South First Street site next week, and we'll begin pricing and budgeting that particular site as well. Construction right now is scheduled to start in March, April. There are some things that we're working out with the developer to ensure that we can hit those dates as long as they can keep up with the closing process with VHDA and some of the other funding sources that they have, and give us about a 6 to 8 week lead time, then we should be good to go. But those things are kind of out of the control of the general contractor. But we are providing the development team with the information that they need to ensure that they can hit those milestone dates. The anticipation is that we will start our construction on the 8th floor of the facility at Crescent Hall and then begin to work our way down. We are trying to work through some logistical challenges of moving residents around, but also working on systems in that particular facility and making sure we can keep those operational while we still have residents within the facility. So we're working on safety plans as well and logistics plan throughout the facility, because we will have active seniors in that facility while we're undergoing a major renovation. So we understand and we're sensitive to the individuals that will be in this facility, that we need to take much caution to ensure that they are safe and sound while we're working. So we have spent a lot of time. I've been here for the last almost 24 months. January would be 24 months that I started embarking on this process with the great folks at FAR who came to Chicago and sought me out. So I'm excited to continue the process with them, and in another 12 months from April 1 of 2020, we'll be opening up a brand new facility at Crescent Halls, and hopefully have the 62 units at South First Street also completed. So thank you for your time this evening.
Thank you.
Similarly, as we're looking at South First Street, construction hopefully will begin in April 2020. As Cornelius said, we have the final construction drawings underway. This will be a 62-unit community in 3 structures, and will include a community center. Total projected cost is just under $13 million. And again, our funding includes the city seed capital at $1.125 million. Continued resident engagement, largely so around relocation planning at this point for South First Phase 1. As we look at South First Phase 2, however, the resident engagement takes a sort of a different look. We've had a resident advisory panel that has been working with our architect partner and development partners help us really determine how best to utilize the site, plan the site for future use. Currently, there are 58 units at South First existing. We'll go to 113 units there. Had tremendous neighborhood support, certainly within the resident community, but also adjacent neighbors. We had an event yesterday at Mount Zion Church that was extremely well attended, and we're very appreciative of the support that the Mount Zion community is giving this project. Total projected cost is over $26 million, again, including the city commitment of $3 million for South First Phase 2. The pictures you see here are some of the resident engagement, resident planning work that's been done to date. And let's see, for those who haven't seen it, and I apologize, I may not have the most recent sort of sketch up of South First Street Phase 2, but this is generally what I believe Phase 2 is anticipated to look like. Let's see. Council's requested, rightly so, a fiscal sustainability model be crafted for CRHA. After some work, we have been able to engage Community Affordable Housing Equity Corp, based out of Raleigh, to help provide a detailed model and roadmap for our redevelopment activities. Okay? This should give us sort of the optimal build-out numbers on the remaining properties. Will allow CRHA to accomplish goals for redevelopment by maintaining long-term fiscal sustainability. If you're not familiar with CAHEC, I certainly encourage you to go out to the web and look them up. They are a phenomenal group. I've done some work with them in the past. It's a nonprofit organization that has been instrumental in bringing very high-quality, affordable housing units online throughout the Southeast. They function in a syndicator capacity generally, but also provide a great deal of the initial planning work. We should have that fiscal sustainability study in hand. Dave Norris?
This week?
This week?
First draft.
Okay, all right.
Just because it's so timely.
Yes,
Just,
yes.
it will include every property after the Phase 2, so it will not include anything that's currently under development.
To include the whole portfolio.
Everything.
So it even include the stuff that you're planning to do with Phase 1 and Phase 2 of South First
Well,
Street?
that's already in the plan.
All right, so you're saying you're going to adopt the plan, okay. Sorry.
No.
Oh,
Thanks, no. Let's see, strategic outlook for CRHA. Continue with our redevelopment efforts of our public housing sites, next focusing on West Haven and/or the 6th Street neighborhoods. Modernization efforts to begin in earnest in 2020. We're in the process of hiring a facilities director to help us sort of identify the appropriate path forward for pursuing modernization work. Continued development and implementation of our Section 3 program. Many thanks to Holly Lee and her tremendous work from the city in helping us identify some strategies to make Section 3 a success. We look for an early rollout in 2020 of our program. We're also looking at some community enhancement initiatives. Very much like to explore the opportunity for a food center somewhere in our public housing neighborhoods or adjacent to, as well as a community financial center, a financial opportunity center, very similar to what LISC provides in other areas, perhaps may involve LISC as well. And then we have sort of ongoing transition planning for leadership at CRHA. After Friday, Kathleen Glenn Matthews, Dave Norris, Claudette Green will step in and take the primary leadership role for CRHA. Kathleen will be the primary point person for the city, and has already begun developing continuing relationships with city staff. I think that should be fairly seamless. Dave Norris will continue his work with redevelopment, and then Claudette Green will oversee all of our housing programs.
What about the crossings too?
Did you come on up for a moment? What did I miss?
Crossings too.
Crossings too. Yes, absolutely. You want to speak to? Why don't you speak to crossings too?
Good evening. So as you all know, the City Council has prioritized funding for a Crossings 2 in your Affordable Housing Fund for this year, and that's contingent upon the Housing Authority being willing to put up land and or vouchers to make that project a possibility. So we've been doing our due diligence and have been tasked by our board to basically look at what that would entail, what are the pros and cons, so that they can make an informed decision. They're having a work session next Monday, the 25th, to consider those criteria, and then they'll have a board meeting in early December to make an official vote on whether or not to proceed. So it's in motion, and they've asked a lot of good questions. They want to just make sure this is a good deal both for the community and for our residents and for the Housing Authority, and that it fits into our fiscal sustainability plan. And so we'll be considering that in more depth next Monday.
And I'll assure council after our meeting next Monday to send an update and report, specifically revolving around crossings too. And I do know the kind of team, quote unquote, that's been working on the crossings too, is ready and prepared to answer all questions that the Housing Authority may have. So it looks like things are in motion in that regard.
In that sustainability study, is that considering with and without that direction?
That's part of it.
Okay.
Yep.
That's probably part of your input. Okay.
Okay. Thank you, Mr.
I
Duffield.
do have
Thank
a question, though. Like, when I think about fiscal sustainability and I think about a housing authority, a redevelopment authority, that authority has the capacity to actually float bonds, issue
Sure.
bonds.
Yes.
Where are we in that trajectory from now to getting to the point where you're that independent to be able to float your own bonds and
I think, and we've had,
secure your own capital?
sure, we've broached this subject, I think, before, that the next logical step for the Housing Authority is to engage a firm to do a study for us to determine a bonding capacity, to determine, yes.
So that's not part of this right now?
That's not part of the fiscal
Not at the
sustainability, but
Okay.
it's certainly something you can contract with the Moody's or someone to do.
And I think it's
I have a,
well, just real quick, real briefly, Mayor Walker, I think it's important to note, while the Housing Authority as a whole is looking to bring on a firm to complete this study, is to be lauded, the amount of work that's taken place over the past few years with the leadership of Mr. Duffield, essentially since he took on an organization that was operating at a deficit, and now clearly for consecutive years you've seen working in the black. And I think the next step, as you alluded to now, getting towards being able to float bonds with the creation of the CDC, that there in itself is to be commended in a very notable capacity. So thank you, Mr. Duffield.
No, it's entirely, thanks to the team and the partnership with FAR and the city to make that possible.
No easy feat, to say
Would
the
not
least.
happen. Yes.
so how much would it cost to hire a firm to determine the bonding capacity that we all are probably sure that
Yeah.
isn't, that you don't have much capacity at this
Right.
time, right?
Yeah, I can find a number for you.
But I just don't know if
Yeah.
that's the best use of funds.
Yeah,
But I just would like to know what it would take to,
Sure.
what do you need to get, I don't
Well,
even understand what you need to
I-
get to have that capacity.
yeah, I think what we need is, what we will need is a relatively, it doesn't need to be a long history, but a documented history of being able to generate revenue in substantial quantities in excess of expenses. What that means is having a blend of income levels in our new development processes, not necessarily saying market rate, but certainly different levels of affordability. You saw our average annual income for our residents. That's a challenge to be able to create the revenue capacity to support bond service. Until we can improve that, it's going to be a challenge for us to float bonds.
But I think it's debatable in regards to whether or not that's the best use of the fund, because I think all of the staff for the CRHA currently would concede that they're working at maximum capacity. So if you don't have the resources within the organization to be able to complete this kind of study, to get the information to council or whomever in a timely fashion, you have to outsource unless the city's willing to step in and provide those resources to do the study for us. But I mean, currently the Housing Authority doesn't have any extra hands to be able to do this work.
Perhaps as part of the fiscal sustainability, we could ask KHEC to put together and just to give us an idea of
That's a
what the
proposal
number would look like.
and a
What
cost
number
to
would
do
cost
this.
would look like. Yeah.
I'm just thinking.
Right,
So-
cost regardless.
So this is my unpopular, I'm sure, comment, but during the budget meeting, whenever, 2 weeks ago, last week, you know, we were presented with a budget that include funding for PHA, which again houses our residents, but is a privately owned versus that this is agency that's directly linked to the city. And in their plan, we were not asking them for this, and they were receiving more money than CRHA were receiving.
But my understanding is that the PHA cannot float bonds. This agency can, and when you can float bonds, you can expand the amount of building you do.
Certainly, they can't float a publicly traded bond. They can certainly take on debt, which is
They can take on debt,
the
yeah.
same, which is the same thing. Yeah.
Tomato.
Yes, I just think that that's something that I'll be bringing up during the just budget process, because back to, I mean, it's difficult when we start, you know, having these conversations as if the issue is the people who have the most needs, either in either one of the communities, right? But the conversations that started back in 2015, where there was considerable discussion about PHA selling the property, CRHA is in a completely different space with that. So I just think whatever conversations we're going to have as a council, making sure that, and I know we're trying to do this through the agreement with PHA, but just understanding the needs of CRHA and making sure that the direct link that we have with them, that we are considering that when we are allocating this funding source, is also very important.
Thank you.
I would agree with that.
So relative to what plans you, obviously sustainability is part of it, but what are other like kind of inputs that this group will be looking at to understand like kind of how you want to build it? Is it based on, you know, demand? Like obviously you have a wait list. I'm just trying to get a sense for what are the inputs that they're going to be using to determine what that build out looks like.
Certainly, yeah, and maybe it would be most helpful to forward sort of the scope that we worked out with KHEC to you, so you can have a look and see what's involved in that.
Bless you.
Yeah, certainly looking at the market demand, certainly looking at our waiting list, forecasting, you know, as best we can what future trends may hold for the Charlottesville area will certainly influence what the final fiscal sustainability plan looks like, and what type of redevelopment CRHA is best served to pursue. Without the scope in front of me, I think that would be something that you may find useful in addressing some of those concerns.
And what is like the ownership structure after the redevelopment takes place? Because it is different than what it is today.
It is, because we're using the low-income housing tax credit process, it is identical to the ownership structure that takes place with every public housing authority that goes through a LIHTC process. We will create a limited liability corporation with a private investor who will provide the tax credit equity to the project. We will be the controlling managing member of the LLC, which means we'll retain control of the asset, the ground, the buildings throughout the development process. At the end of the LIHTC compliance period, the private investor vacates the partnership. That's spelled out in the partnership, in the LLC managing agreement on the front end. And 100% ownership of the LLC reverts to CRHA.
But you
And
have to
that's at
pay
the-
for that, though.
No, I don't.
No.
But that's at the 15-year.
That's right.
15 years.
15 years. No, there is no, I understand that there was some confusion, I think, around PHA at one point about having to make some type of large buyout at the end of a project. That's,
Well, that was, I think, different,
Yeah.
just because I'm familiar, if my memory serves me correctly, but that was because they had a joint partnership with National Housing Trust,
okay.
which was different from
Yeah.
this. That was
Yeah.
outside of the tax credit
yeah.
investors. So they had a different process that they were.
No, there is no
discussing.
acquisition, there is no monumental acquisition cost at the end of the 15-year period. All right.
I appreciate it, Mr. Duffield.
Council, thank you very much for your time. Many thanks to Brian Wheeler, because very literally, this couldn't have happened without, thank you, Brian.
And Mr. Duffield, you can, if you could, send this presentation to all of
Yeah,
council,
that'd
just
be
so they
great.
can have it for record.
And thank you, Mr. Duffield, for your service.
Service.
Indeed.
Thank you very much. I really, I sincerely appreciate all of you. And I'm thankful to have had the opportunity to work.
Thank you. And the next part of the presentation goes hand in hand with the CRHA, so don't get too lost, Mr. Duffield. Yeah, he out. And colleagues, just while Ms. Webb is coming up, just so you know, this is the team presentation, which is a partnership, as we've discussed before, the partnership between the Housing Authority and the Ting Internet provider about the Digital Inclusion Project. We have Ms. Monica Webb, who is the extraordinaire from Ting, who flew all the way in from Toronto, Canada, to be with us tonight for our presentation. Thank you, Ms. Webb.
I just have one more comment before
Sure.
you start. I wanted to just highlight that, again, our area median income is $89,600, and they discussed the average income at CRH properties being $13,000. And so when we're talking about the investment and how to correct that, right? First of all, it's going to take, a lot of different partnerships throughout the city to correct that. But the easy way to think about correcting that is that we immediately talk about, infusing different income levels into the neighborhoods. That doesn't change the outcomes for the families that live there at that income level. So when we're talking about the other investments in schools, the investment in living wage, possibly being able to change that with, if the General Assembly allows us to fix, to change laws in our area, the work that Councilor Bellamy has been doing on with the minority businesses and startups, like all of that is the factor that shifts those numbers. So we can't just think about it in terms of, oh, we can change the income in communities just by putting higher income people in it. That's all. Just didn't want to forget that.
Thank you.
Thank you, Wes, for the introduction. Thank you very much to council staffers and everybody here for inviting us to speak this afternoon, this evening. I'd also like to welcome Kara Shandison, who is the Ting Charlottesville City Manager, who's here with me this evening. She's more the day-to-day face of Charlottesville here. In the early years of Ting in Charlottesville, I spent a lot of time here. Sometimes I was here for weeks or a month at a time, so I feel like I know my way around. I did fly down for this from Toronto, but this city does have a very solid place in my heart as a wonderful place to visit at this point for me. We're very passionate about this particular initiative, and I wanted to give you a little background on the partnership itself, an overview, because I know it's been a while since we came and talked to council about it. And also, for those of you who may not know about Ting, I'll give you a quick synopsis. We bought a very small fiber business that was started by two entrepreneurial UVA students, and it was in the center of Charlottesville, and it provided service to some businesses. And that was, we bought that early 2015. And since then, we've worked really hard to expand next generation gigabit fiber infrastructure here in the city. But I think more importantly, we've really worked hard to be a credible, contributing community partner. We've provided service to over 20 nonprofits that serve specifically Charlottesville. We have sponsored initiatives and events that have served the Charlottesville community and specific stakeholders, children, women, the technology industry. We do all the Wi-Fi at JPJ and Scott Stadium. But this is really the initiative that we are the most passionate and excited about, because it's what we do, and it's something that we feel can have a significant benefit to populations that might not otherwise afford to have a great benefit, that can help things like access to education, not just for kids, but also continuing education, job transitioning, access to job opportunities, potential for starting businesses, access to government services, in-home health care. All of these things are things that we all take for granted. Full participation in civic life that not everyone has access to, and this is something that we do every day that we're excited to be able to leverage and offer to the residents, the CRHA residents. So just an overview, it's a partnership that started really discussions with the city, with Wes, and CRHA about bringing affordable gig internet access to the residents of all CRHA, all of the housing. So every single unit would get a full symmetrical fiber optic connection, and we would offer that service, which is regularly $89 in the city, for $9.95 a month. The way that it's actually working is we'll bring the fiber to each property. CRHA and this, via city subsidy subsidizes the installation, and then we do we'll do the ongoing subsidy every month for that service. We're now in the process. We are working very closely with CRHA, our project manager, and their project managers to complete the build. And we're also talking a little bit about the planning of, the communicating with residents. As we saw in the previous presentation, it's really important that everything be very much centered around the residents, and as much as we can have driven by the residents, the better the deployment will be. So in terms of the status, we've executed the contract. Ting has completed a high-level design, a timeline, and a project plan. We're now in the very specific discussions on which sites are going to happen, in what timing, and then, as I mentioned, early planning for how we would actually implement this with residents. I'll next take you to the timeline. This is sort of detailed each different residence, but the next slide actually gives you a better visual of how each site will be prioritized. We're starting with Crescent Halls and the South First Street phase one for, for obvious reasons. Those are being redeveloped, and it's really easy and quick for us to do that during the redevelopment. We're also starting this year on the planning for 6th Street. And then we'll be starting the project management. You can sort of see how it's escalating the various sites. The one site I will note is not on there is Mitchie Drive, and that's really because we haven't expanded our network up there yet, and so that will likely be start planning in later 2020 for deployment as well in 2021. But I don't have an exact timeline on that specific site. But we are committed to doing all of the sites and all of the units, including the expanded units for the South First Street location. So that's that's really the full overview of where we are now. I wanted to make it fast. I know that it's been a long evening, but I would like to open it up to questions from council or residents on any of the details of what's happening.
Thank you, Mom. Great job.
So I know I asked this question before, but just for clarity, because it's been a while, in terms of how will the redevelopment impact? So if you do it now, and then, because this November date possibly can't happen based on their time, they're gone, but the timeline they specified in the previous report, or if you do it, do you have to go do it again, or?
No, we're actually going to be working along with them floor by floor, so that when the new residents move in, the service will be in the units.
Yes, but I guess I have a question. My question is, if you do it before, like for the projects that are going to come up for redevelopment in the future.
Right.
If you do this now and then the property is redeveloped, what happens at that?
That's a great question.
Okay.
That is a great question, and certainly we would, work along with you at that time to ensure that, if you were stripping it down to the studs and that meant taking out the fiber, we would have to work along with you to make sure that, we're redeploying it at the same time as you're doing the construction when the walls are open.
Well, this would be like completely redeveloped.
Right, and the contract is for the existing sites and the existing redevelopment, so we could certainly talk about similar terms for new redevelopment. But we hadn't really, we hadn't necessarily contemplated it at this point, but it is, I think it's something that's important to consider.
And I think the part that's missing in that response is that when we look at initially when this came about last year, when we went forward with the budget request and then allocating the funds, we want to make sure, as we heard from our residents, that there's a digital divide now. So us looking to do what we can in the immediate to be able to provide these services as fast as possible. What's the thought process behind that? And then the fact of the matter also remains that it takes a substantial amount of time to do the fiber optic at each unit or each building, and then to do so in each particular unit. And the fact in which they're going to be waiving a lot of costs, and then we're paying some of it, is what kind of is expediting some of it. And that's the thought behind, let's try to get this done now. And even as we look at new redevelopment, quote unquote, we can address that, as Ms. Webb alluded to, working hand in hand.
What was the dollar allocation for this again?
$450,000. Yeah. $450
I think it was $150,000.
$150,000, $400.
But it was $400 per unit.
Yeah.
Yeah.
$150,400.
So
not 400. That would have been really bad.
But even, I think, just moving forward, Mr. Norris, I think it just would be helpful to see in terms of, if they are not deploying some sites until they're unable to, until the 21, you did say 21 for something.
Mm-hmm. Yeah, I mean, that's mainly the phase 2 of South First Street. And that's because it'll
but
be
you said
it'll
something
be along
about
with
Mickey
your
Drive too, right?
And Mitch, yes, that one as well.
I just think, and everybody's in the room who would be here to make those decisions, I guess. But, just making sure, since we are talking about the amount of money that's needed for everything that we're asking for that it's just important for us to make sure that we're not doing something twice if we don't have to. And Dr. Richardson, the slide from the CRHA point where it said that including the 3 million for fiscal year 21.
We still have to sit down with them and actually make sure that we
Pull your mic
work
up,
on
Doc.
it. That was loud enough tonight.
Yeah.
Working with Dave Norris and the other team, we talked about that, and along with Brenda from our team, to be able to talk about that in terms of the total expenditure, looking at 21 that they're actually going to expend, as well as what's being spent in FY20, our current fiscal year.
So just council-elect is just something that we,
Oh, yeah.
you know,
yeah,
have to
yeah.
probably modify.
Yeah.
But right now, I mean, the timeline for those funds, like, I don't have, it's not up here now.
There was a 2021 date on that slide, would also said the 3 million versus the 1, and this is a separate conversation.
This is
within-
separate
But
from
the
you
question
right
I'm
now,
saying
Ms.
is
Wood.
that when are they gonna be ready to actually build phase 2? What was that timeline?
But this was around the conversation that we had about the, just when it was ready to make sure that the funds were accessible versus not. And right now, if it's only 1.5 and they're expecting at least 3, then that's,
Yeah, well, they're bondable dollars, so I mean, you can always move it and increase it as they need it. It's 18 million over the next, well, 18 million inclusive of FY20, which we're in now. But what we did, we spread it in terms of the use or the projected use. And like I said before, with the capital dollars, we want to make sure that the funding is available, you know, for those particular years if they plan to use it, because, you know, like I said, there's other competing capital projects, capital dollars that need to be expended in different areas. So we want to make sure, and that's why we're trying to really, truly understand, you know, what they're going to be spending, you know, year 1, year 2,
Yeah.
so on and so forth.
So a question for you in terms of an area like Charlottesville, the city as a whole.
Yep.
Is this something you all have done as a company in terms of providing this kind of service for a city?
We have not. This is going to be our inaugural initiative doing this. I mean, Charlottesville was the first city that we actually built anyway.
Yeah.
But this is, you know, and it's going to be, it's the largest city that we'll have done soonest. We have a couple of other builds that are done, but they're much smaller.
Well,
So
my
this is
question
for
is not just the CRHA properties.
Right.
But are there cities of this size that are providing internet access for citizens overall?
In the way that they're doing it, no. When we were doing our research initially, this was like one of the first of its kind, and there may be other providers who say like they offer, and I won't say their names, but there are other providers who say they will offer like a $9.95 or an option for individuals to take advantage of internet, but it's not fiber, high-speed internet like Ting is doing. And this kind of internet, just the fiber optic high-speed, is new there in itself. And then doing it on a massive scale, like at 6 different sites for an entire public housing unit, there's nothing else like this that can be found, which is also why it's taken a little bit longer than some may have expected. But we want to do it right, and again, it's the first of its kind. And it's mind-boggling when you think about the fact that our public housing residents are going to have faster internet speed than what you find at City Hall, faster internet speed than definitely what's at my house, most schools, I mean, mostly anywhere in the city. This will be a way in which we can close the digital divide, unlike many other places in the country. And I'm really proud of the work that we're doing in that regard.
Okay, we can,
I
my
will-
question.
I will say though, despite the fact that it's not being done, there's so many cities that are grappling with it and are looking for solutions.
Yeah, I don't think let me try this again. So the city as a whole,
Yeah.
right? Are there localities that are providing access to internet service as a whole, like the government paying for the
Oh, yeah.
infrastructure?
Like everybody.
So like Knoxville,
just-
Knoxville, Tennessee is doing something similar. I mean, you see
So
cities who are
there
doing
are
such.
certainly cities that have built the infrastructure themselves,
That's
and
what
in
I'm
some cases provide service. We work with the city of Westminster, Maryland, where the city built and owns the fiber optic network, and we just provide service over top of it and operate it. But there are other cities that do the whole package around the country.
Yes. So Dr. Richardson and I, we were talking about this, and I've asked before about, looking at exploring what, with the size of our city, if that is something that we could explore doing, and how that conversation starts for the city.
Yeah, I mean, we can certainly, we can certainly have that conversation. I would probably say the enormous capital outlay, it would be like building 2 electric distribution systems. Fiber optic is really the next generation of infrastructure. It doesn't mean that, there may be areas that you would like to see built that are not built yet. We can certainly talk about that, but I say this as somebody who lived in a rural area where we didn't have access, and I was actually on, I was on the municipal side of things. We did have a plan, and we're moving forward to building a municipally owned network where we would provide service. So I've seen it from both ways, but it becomes very risky for a municipality to overbuild an existing fiber network.
Okay. That was my question.
Any other questions from my colleagues? Thank you.
Thank you very much. Thank you for coming
so
down
much.
from Toronto.
Thank you.
Well, the weather's nicer.
Happy to serve.
High-speed internet.
All right. Next, we have the Mapping Seville project.
Hi, everybody.
Hey, what's up,
Hey.
Mr. Yeager?
Dr. Bellamy. Can everybody hear me okay?
Yes, sir.
All right. Long-time listener, first-time speaker. Many of you I know through my capacity as a journalist. I grew up here in Charlottesville and covered Congress for the first part of my career, covered federal government in D.C.
You might want to introduce yourself.
Your name.
Sure, it's Jordy Yeager, sorry. Yeah, Jordy Yeager. I'm a resident of Charlottesville. I'm a fellow at the Jefferson School African American Heritage Center. And when I moved back, I started focusing on stories that I felt like were falling through the cracks. And so a lot of that had to do with poverty at first. And the more I dug into stories, the more the racial divide became very clear in those stories. And so many of those stories I've talked to you about throughout over the years. And so you're familiar with a lot of these statistics. But it shows up at every juncture of life. And so it shows up within the law enforcement system, within the racial disparity within our kids, within our adults, whether it's probations or arrests or intakes. It shows up within our education system, as you well know. It also shows up within infant mortality, within hypertension, diabetes, within outcomes related to health, physical and mental. It shows up in our fiscal system, so our economy. This bottom graphic right here is from the Federal Reserve. It looks at the median net worth of individuals throughout the country. This was a couple years ago now, but if you look at white families, the median net worth is $171,000. If you look at black families, that's $17,000. So that's about a tenth of the net worth. If you look at how it shows up on a regular basis, you all know how many the percentage of contracts that are awarded to minority-owned businesses in Charlottesville as well. You have that reality, which is very stark and very real for a lot of individuals, and then you have this reality, which is one that's celebrated and kind of broadcast throughout our boundaries and throughout the country. And so as a journalist, I started seeing these disparities not only in outcomes of life, but also in realities and experience, and started looking at how they show up and why they show up. Here. One of the first big clues I got was from Rich Schuyler's Orange Dot report. He's now, I believe, on his fourth iteration. He's delivered 3 of these reports. This is the second one. And in there, obviously, he looks at what it takes to be self-sufficient in Charlottesville as an individual living here and what that actual cost of living is. But buried in this second report is a study that Raj Chetty has done. I imagine some of you are familiar, if not all of you are familiar with his work. He's a socioeconomist that from Harvard that looks at a myriad of things, but particularly with regards to this, income mobility. And so in this study that he conducted, he looked at 2,855 municipalities of similar size. And in all of those, he looked at what is the likelihood that if you're born in poverty that you can get out of poverty, right? This threshold of income mobility. And he looked at Charlottesville, and he found that Charlottesville ranked 2,700th out of 2,855, meaning there are 2,699 other similarly sized cities in which you can live and have a greater chance of getting out of poverty. And so that started this conversation around jurisdiction and environment. And so looking at proximity of where people live in relationship to one another, and then looking at life outcomes that result. Raj Chetty's work resulted in Opportunity Atlas, which is a website that takes census data and maps it, looking at different life outcomes. So it looks at incarceration rates, it looks at marriage divorce rates, it looks at income and wealth, it looks at education rates, and it looks at it by census tract, and it also looks at it by race and by age. And if you look, for instance, at the 10th and Page census tract, you can see that the average income for a household is about $19,000 if you're black. If you go one block to the west into the Venable neighborhood, you start to see that income rise to $67,000 for a white family. So just to go back and forth, these neighborhoods obviously are side by side with a vast income disparity between the two. So how is that? And how is it that environment is the predictor of life outcomes? So at the Heritage Center, we started to ask that question historically, looking at the records that have led us to this point up till now. And if you start back in 1818, you start to get a sense of how this city was laid out, the grid structure for which it was laid out. You jump forward about 60 years and you start to see that most of that plantation landscape in all of Albemarle County starts to become developed the closer you get towards its urban core. So you see these names that are in all capital letters, those are the plantations. You have Belmont, you have the farm, you have Windhurst, Montebello, Locust Grove is a plantation. The italics are the white men who enslaved people at those plantations. Those then are bought up and subdivided towards the end of the 19th century, and they're built into neighborhoods. And those neighborhoods start to blow out and out and out into this process through annexation that we see the county land becoming city land. As that's done, large subdivisions are getting put in. And this is one of the first. So this is Locust Grove. I imagine many of you are familiar with it. It's oriented on up is west and down is east, so it's kind of sideways. But if you look at the top left, it's the Maplewood Cemetery, and then Freebridge Road, which is now East High Street, just to orient you. In the middle is Locust Avenue. These are 140 parcels that were put in 1897 and sold off to individuals, right? Up until now, this is a rural landscape in the city. These parcels all have deeds that are attached to them, and in those deeds is this particular clause. It is also agreed that this land is not at any time to be sold to or owned by Negroes. Right, this is known as a racial covenant, but throughout the country these go in. This is one of the earliest. And so we're not unique in that regard, but it is definitely one of the earliest in the country's history, seeing segregation of residential housing by race. We decided, wouldn't it be interesting to look at that on a map? So those are the 140 parcels that were existing in 1897, put into GIS on a map. And we started to want to be able to prove a much firmer hypothesis and a much firmer case. And so we started to go through the records. And of course, from 1912 to 1917, we didn't need racial covenants in the city because we passed an ordinance that said if you're living on an all-white block in the city, that you cannot sell or lease your home to a black person. Supreme Court decides in 1917 that that's unconstitutional, and we go back to racial covenants. Like in 1915, this one, Meadowbrook Hills, they stick with a very short sentence that says, that said lot shall not be leased to or sold to any person not of Caucasian race. Look at how many properties. This property platting goes through at least 9 pages of property deed books. That's quite large. And down in the lower right-hand corner is what it looks like in GIS. 1923, you have Fry Springs. That said lot shall not be leased or sold to any person not of Caucasian race. 1926, 2 years after the lease statute is put into place, no property in the subdivision to be sold to or to any person not of Caucasian race. 1927, Oak Lawns. 1927, Park Plaza. 1928, this is an advertisement in the Daily Progress for the Lions Place subdivision just off of Park Street there. Again, that said lot shall not be leased to or sold to any person not of Caucasian race or occupied by any member such other race except as a domestic of the owner or leasee. 1930, Overhills, which is on the south side of town. 1936, Piedmont. 1939, Rugby. 1941, Locust Grove Extension. 1947, Monroe Park. Now keep in mind, I'm doing all of this work on my lunch break. And so, from taking a cue from the great local historian Sam Towler, that if you want to start to develop a proof of concept, you have to put in the time. And so I was going and talking to title searchers at the county courthouse and the city courthouse of where are these initial title plats? And so they were showing me these individual ones. But imagine how many of these we didn't find. This is just what that baseline lunch break mapping starts to look like. And so we took that proof of concept to the Charlottesville Area Community Foundation. And through the Heal Charlottesville Fund, we started to, we got a grant and we started to make a more methodological scientific approach to all of this data. And so we requested from the city and the county access to all of their digitized records, and then began to digitize the records ourselves, the ones that predate that existence. I would love to spend a long time going through each of these individuals, and obviously you see it cuts off, there are many, many more. Over the last year, we've been able to form some incredible partnerships, both with local residents and nonprofits, as well as city staff, as well as county staff, University of Virginia, historians, the list goes on. And so I did want to pause just for that and say thank you to all of these individuals. They definitely know who they are, but their work would not without their work, this would not be possible. From going into specifics, and I know we're short on time, I wanted to just talk briefly about what the process is. And so from the city level, we've gotten 152,000 pages worth of property records from David Schmidt and Lizelle Duggar through the city court. And then in the county, we've got 150,000 pages. With those, we're then running them through something called optical character recognition that allows us to search for certain specific terms, such as Caucasian, such as Negro, such as banks and lending institutions. With each of those, we flag and pull out the ones with racial restrictions. We are not the first to do this. Washington, D.C. has a project called Mapping Prejudice that's quite far along, and we have been in close communication, and they've been a tremendous asset and help to us. The first and big project of this kind is in Minneapolis, however. We have 300,000 pages worth of records. They have 4 million pages worth of records. And they are 5 years into this process. They are also adamantly looking at the effects of these policies on today's housing market, right? So in these white restricted neighborhoods, what is a home worth today? And they found that the median home in the city is a certain level, and that in these white restricted neighborhoods, homes are $36,000 above that median level. And in these black neighborhoods where residents were forced to live because they couldn't move into these other neighborhoods, the median home price is $66,000 below the median level. So this has a very tangible effect into our daily lives, just in that wealth accumulation and property value metric. But we're taking it a step further with the Mapping CVille project. Because we have 10 square miles of a city, we're looking at how infrastructure has affected these neighborhoods over the years. And so you remember I said that this landscape was very rural. It was not urban. It did not, it was running off of well and creek water up until this point. So it needed to get put onto the city's grid. It needed water. It needed sewer lines. Eventually it needs to get its streets paved. It needs electricity and telephone lines. All of these requests are requests that are made in the city minute books and the Board of Aldermen minute books. And so we're going through and digitizing all of these records, looking at where are the petitions and who is making them. In 1917, this is an example historian Steve Thompson flagged for me, and it says that this is Kellytown. So it's a neighborhood that no longer exists, of course, but it's named for a black family by the last name of Kellys, that is existing at the time in 1917 right by Trinity Episcopal Church today, so at the base of Washington Park. This is a request and a petition for a sewer line and a water line. And it says the conclusion reached by the superintendent and myself is that the line would not prove a paying proposition. Now, anecdotally, we know that this is not unique, that this was a frequent response to black neighborhoods that are making requests of the city for these basic quality of life infrastructure investments, that they're either being delayed significantly 5, 10, 15 years or outright denied, right? And so what does that start to look like on a map? And this is from 1925 to 29. It's just a five-year window, but it starts to give us a picture. And then what we're going to do with that is start to line that up with the racial segregation and the racial covenant maps so that we can see in relationship to white neighborhoods that are being, who is being invested in and who is not, and how much, and what is the outcome of that down the line. Of course, this is one of the justifications for raising Vinegar Hill, that they don't have indoor plumbing. That's a far longer conversation, but it revolves around the myth that these properties that did not have indoor plumbing were black-owned. They were not. They were owned by a white man, and not kept up. And they sat in direct proximity to neighborhood homes like the Bells and the Johnsons that were meticulously cared for, and that's accounted for in the assessment records. But again, that's another conversation. The home valuation prices of these homes, what happens when you get a water line and a sewer line in your neighborhood? Does your home go up or down in value? Right? This is a basic quality of life investment, all the way up. And the opposite is true too, right? If you don't get it, what happens? Does your home fall into to neglect, into disrepair? Obviously, this is the #1 way that wealth is transferred in America. And so when we're talking about this national statistic of 171,000 to 17,000 divided by race, what is the government and the market's complicity in all of that? What is then the outcome for education? Can you take a second line of credit out on your house? Can you sell your house? Can you get a second property and rent that property? And then can you send junior to college, right? And so we are talking with families who lived in white restricted neighborhoods, who bought the first time home in 1948, who then are living that reality of what are the benefits to those families. Again, what is the health outcome, eventuality of these homes, and how is it connected? And of course, what would it look like to map stop and frisk data on top of this racial segregation history? Of course, you can't just stop there, right? The most obvious and probably most apparent to many of you is looking at our zoning. And so that is where Minneapolis has really taken the lead, and they, as many of you know, have just approached single-family housing with this historical perspective of looking at how these neighborhoods need to be intentionally made available to the majority of residents, and not necessarily to a select group. And so I've been talking with members of the Planning Commission and other city staff about what that process might look like in terms of incorporating this historical data into that zoning and comprehensive plan update. An interesting thing I came across in my research was this 2015 HUD rule, in which it looks at the Fair Housing Act, right? So these racial covenants are done away with. They're made unconstitutional with the passage of the Fair Housing Act in 1968. This rule in 2015 says the Fair Housing Act not only prohibits discrimination, but in conjunction with other statutes, directs HUD's program participants to take significant actions to overcome historic patterns of segregation, achieve truly balanced and integrated living patterns, promote fair housing choice, and foster inclusive communities that are free from discrimination. Right, so this is saying do no harm, no further harm, but you also need to undo what harm was done. And I think that that is something that is much more challenging because the research has not been done up until this point. But it is something that I feel very strongly needs, that we need to arm you and other decision makers with that capacity to make those decisions in a more informed way. It's also something that is very emblematic and an example of the type of work that's being done at the Heritage Center. And so through the Isabella Gibbons Local History Center, we are trying to do more of this research, and not only to benefit policy decisions and provide a historical capacity we've not had up to this point, but also to incorporate it into schools. And more on that in a second, but first and foremost, this will live as exhibition. And so in this space on the first floor of the Jefferson School, there's a large wall that is very, very perfect for a digital display map in which you can interact with all of this data in map form. So you'll be able to look at the role of banks, for instance. You'll be looking at the role of all of these different other life outcomes in relationship to this pattern of historic segregation, and then looking at evaluations of homes, of course. So we we know that policymakers are one thing, but how do we make sure that this next generation is not going to make the same mistakes that our predecessors and some of us have made? And so we are bringing that into the school systems and very actively talking about this history, but also opening up that conversation of what do we do about it, and how do we make amends for this, and what is the path forward. Where their eyes light up, and I know I'm running short on time here, but where their eyes light up is when they start going through the record books themselves, right? Is when they start looking at their own properties or properties that they're very familiar with. And I'm really struck that this is a personal history, right? This is a history that is very, very deeply embedded in who we are, but it's also a history we don't talk about. And so in talking directly with students, we're able to have those hard conversations about what are the legacies that this has left behind, what are the ramifications that have not been addressed, that this is still very much, you see its fingerprints on. And we've had great success with students, and so we said we need to do this with adults. And so that is really where this public portion and this public-facing portion of the Mapping CVille project has landed us, is looking at how do we engage with this history. And what better way? We have thousands and thousands and thousands of these racially restricted covenants that we need entered into data form so that we can map and create this tapestry, this landscape that we're talking about. And so we created a system through the help of this program, Zooniverse, that allows a very simple format for individuals to look at a property record and then to answer a series of 10 questions, right? What date was it written? Who is the buyer? Who is the seller? How much was it sold for? Nothing complex. It's all in there. We have a whole tutorial of examples of how to find this information. And every single deed helps. Well, like I said, we have thousands, but if you can just do one deed, that helps. And it also allows for folks to experience this history firsthand, to experience it in a way that I think is very, if somebody's speaking at you or to you, you hear something, but if you're engaging with it yourself, you hear it a whole nother way. And that hands-on learning is probably the best learning. And so we're unveiling this tomorrow. We're also holding a 4-hour series of tutorial sessions. There will be 10-minute trainings. It won't be 4 hours. It'll be 10 minutes, but I'll do a series of these, so 12 of them back to back to back, so you can come at any point, and you'll get the same information, wait 5 minutes, it'll start again. And then we'll have the computers open at the African American Heritage Center so that people can try this, can actually start to use it on their own. I've been speaking to churches, I've been speaking to neighborhood associations, I've been doing outreach at schools, obviously, and trying to make people aware of this history, but also aware of this way of engaging with it, towards hopefully an eventuality that attempts to solve some of this, attempts to undo some of this. And so that's where we are. It's Saturday, November 23rd from 2 to 4 p.m. At the African American Heritage Center, and then stick around for Tanisha Hudson's film, Legacy Unbroken, at 6 or 7, I think, right? 6. But I'm happy to answer any questions. I know I've gone over my time.
I have a question.
Outstanding work.
Now, would this be able to also map the covenant restrictions on accessory dwelling units?
Yeah.
Because that is a serious problem with the underlying covenants, and because especially when we were trying to insist on having an accessory dwelling unit on a city property that we were selling, and then we thought we had the deal, and then the attorney came back and said, no, you can't insist that this happens. And I think, Dave, you were on council with me that time. It was in Greenbrier. And we were just told that this is an underlying covenant that says, no, you cannot have accessory dwelling units.
Yeah.
So to me, that would be amazingly impactful to be able to map that, and then we could know what sort of legislation we need to change it, like wholesale, because we're moving towards having a more aggressive accessory dwelling unit policy.
Right. No, absolutely. If that's contained in the deeds, we can 100% map that. And it's interesting, one thing I didn't mention was as the language starts to shift towards zoning, a lot of this language that is in deeds starts to get taken out, right? Setbacks, things that are stipulations on the house and where it's situated in relationship to the neighborhood, it starts to get adopted into things like zoning, leaving, up until 1968, you get left with that racial restriction. It's the last thing that's in those deeds as far as covenants. I imagine from 68 to today, you have things like the ADU ordinance that are in there.
Right. I mean, because that would have been, it would have been race earlier, and then it changed to income later.
Exactly. Yeah.
I'd just like to commend you, Mr. Yeager, for your phenomenal work. as well as Dr. Douglas at the Jefferson School.
Yeah, this would not be possible without Dr.
Yeah, having the foresight to be able to bring Mr. Yeager on. I remember you carrying these big, large notebooks. Like I was seeing you, like, yeah, I'm mapping this stuff out, and to see it all come to fruition is really cool. One question, though, you brought up the idea of putting the digital, I don't know quite what you would call it, but having it on the wall.
Yep.
Do we know how much that would cost?
We've got some specs on that in terms of pricing it out. We've got some of the money from CACF. Obviously, this is part of a larger series of exhibitions.
Right.
Dr. Douglas, do you want to speak to?
It's part of our exhibition budget. So this phase of the exhibition.
She knows she need to come up here. I don't tell her she never gonna
So yeah, it's part of our exhibition budget. So this phase of the exhibition total, and there's the map, and then there's also some interactives on the other side of the wall. It's about 90, almost $100,000 to put it.
Right.
But it has a lot to do with the interfaces in respect to that.
And see, when I think about easy wins for the city and easy things that we can say/do that show that we're working towards equitable initiatives, these are the kind of partnerships or things that we can help sponsor in that regard that puts us in the light that shows people we're putting resources behind our words. And I know everyone thinks that I just want to spend money all the time.
I don't get asked for anyone ask for money.
Yeah, but I mean, I think.
Though, if you'd like.
We're not even asking for money.
Everything tonight.
Yeah, but I think associating ourselves, though, see, some things you have to, and I'm being serious, like, some things it's important for us to, even, someone doesn't have to ask you for us to be a part of something. And we as the city, and with all of this stuff happening in the city, it's important, in my opinion, for us to be able to provide support in that regard.
The investment, well.
The investment, correct.
Go ahead.
No, I was going to say that, I mean, one of the things that the work that's being done is, Jordy mentioned the work that he's doing with students. This is also, we're going to do a teacher training program in June.
Right.
And all of this data that we're collecting right now is part of what we're going to teach teachers how to do as well. So they'll be able to move from this information to creating story maps will then allow them to use the information in the classroom. So it's a little bit more than just saying we're working with students on the ground. We're actually trying to build this into an entire system that is curriculum-based as well. So
And see,
there's many opportunities.
Having discussions with Dr. Douglas about this over the week, I think it was Friday, and I think that arose from part of the $15,000 from the original equity package that we worked on and we passed. I wrote and we worked on and passed in 2017, but that's only $15,000 of, I think you told me it cost 90.
Yeah, the whole overall budget's 90.
That's what I mean.
For
So
the
like,
teacher training
there's
stuff.
there's different things that we as a city can associate ourselves with to show that we're putting forth the right effort or putting forth our effort in a large regards.
Yeah.
But I appreciate your work.
And I think it's important to understand, I know, I'm just pointing this direction, but when we talk about the investment back into the city and what does that look like? When it talks about us being patient and doing things holistically instead of making zoning changes, per request versus waiting for a holistic comprehensive plan and housing strategy that hopefully will take this type of stuff into consideration. Because back to what CRHA said during their report, a lot of people think that when you're talking about family members who are at a $13,000 annual income that is based on their doing only, and you can take information like this and say, oh no, you have what you have because there were things such as, and pull up on the screen, in place, right? And so your generational wealth has been created as a result of this, where other people were legally ousted from even being able to, participate or, not being able to participate initially, right? And so that changes the dynamics of especially what we talk about in the city of who has and who doesn't and who thinks they should be able to maintain what that access look like. So that's what I was thinking about doing the whole presentation, and to be able to fund if requested. I'm not saying anyone requested anything, but I'm just, when we talk about dollars going in to be able to even influence, and if there are no dollars needed, what this, I think information like this, being able to look at it while we're getting a comprehensive plan or housing strategy done, especially when we have the feedback from the community of, I don't want certain type of units here, I don't want you to build high here, I don't want you, and to be able to compare that to neighborhoods who have been historically able to say who they want there and who not, and it's based on race, I think is important.
Indeed.
Not that that was the intention, but that is what went through my mind when I was seeing this presentation.
Yeah. Also, lastly, Jordy, that presentation also reminded me of some of the progress that we've made. You put up some things that I think we all, when we initially saw them, were shocked by, and then we made some changes. Like, I remember us having a meeting about the 0. or less than 0.5% of minority contracts or contracts going to minority businesses, and then subsequently we did the minority business task force, which turned into a commission, and then that laid the groundwork for the business equity fund. So I mean, in some ways, even since a lot of these things we've made strides, but there's still a lot of work left to be done. So I can't thank you enough for the work in which you've done, man. You're absolutely brilliant, and I think it's to be said. And I don't know if you get complimented in that regard enough, but you've done a tremendous amount of work for our community, man, and it's really appreciated. Thank you.
I agree. I just want to, yeah, I think that understanding the history can have profound impacts on what we're doing in the present and the choices we're making for the future, particularly at inflection points like what, Maggie's research uncovering the roots underneath the Quest program was, and that was just a result of a master's dissertation, but it had an immediate effect, because when you see where something came from, it all of a sudden, it increases the stakes, it frames up the choices, it makes you very aware of the burden of history and changing history. And I think that so I can imagine this as it gets completed, really having very profound effects on future council's decisions about all kinds of things related to how, especially at a neighborhood level. I mean, it's really interesting because we face big questions about these neighborhoods and how the city is thinking in terms of neighborhoods all the time. And so anyway, I really appreciate it.
From the neighborhood position with respect to public health, we
Absolutely.
did some work with the health department.
I want you closer.
Months ago, where we were looking at maps and really literally saying those things that you are making assumptions about, we can drill down even further into that and correct some of those assumptions that you're making that are just based on a certain level of data, right? But once you start taking that historic information, it allows you to drill down. So when you're asking questions about why does, obesity levels in Ridge Street neighborhood look this way versus the Venable neighborhood, lots of that is in the historic data.
Yeah.
So it has really far-reaching
It
implications.
does, and going back to Dr. Douglas's point of engaging with students and teachers and schools, while this work is being done, we're also going through John West property holdings, and what does it look like to engage with a fourth grade class who's learning GIS and getting them to help you map John West properties by going out into the field and doing a geolocation sort of thing with your phone, and then learning about the history of Black property ownership and Black wealth and Black power throughout the 18th and 19th or 1800s and 1900s, and showing that historically leading up to today, so that we don't start the conversation in the 70s and the 80s and the 90s. That this is a longer arc.
Thank you.
Great.
Thank you.
Thank you very much.
All right, man. Have a great evening.
All right, next we have the, I'm sorry.
I was just going to ask very briefly if Mr. Yeager had a minute on the comprehensive plan that's being rewritten. Have you had a chance to talk to the folks in Minneapolis and how that was incorporated into, the mapping was incorporated into the plan itself?
Yes.
Oh, you have the answer.
Those conversations are very much ongoing. Those conversations are very much ongoing, but I have that line of communication is open, and so yes, looking at, I think some of their zoning policy is very different from ours, just in terms of scale and situation, but there are a lot of comparable overlap. And so, yeah, and Lyle Soliates is as well. I don't know if others are, but I imagine that that's something that's easily talking about. And not only with that, but also with Richmond and Harrisonburg. And so, you know, I should have said that these partnerships are just not regional in terms of Albemarle and Charlottesville, but also expanding throughout Virginia as well. And so other cities are very interested in what does this look like in their own backyard.
So, may I ask, have you made this presentation to the Planning Commission?
No, not yet. I'm in talks about when to do that.
Because, and following up with Mr. Blair, is that they're going to be the major director, if you will, of our comprehensive plan update for the whole city and the housing strategy and the zoning rewrite. So, yeah, I would think it'd be very important for them to be really up to speed on this, and then make sure that the consultants are in the room.
Yep.
So that there is an understanding of how to make a connection between this data and new zoning implications.
For sure, no, 100%. And I would add that I've had several conversations with developers and with architects with the private side of this as well, and they are just floored, right? We don't teach this history. It's not something that's innately known, and so to learn this as you're developing a multi-million-dollar project has been startling. What that then looks like in terms of changing or reorienting how one progresses in that process, I think, is where that.
And also, this is a community engagement tool
Yeah.
as we go into the communities to begin to talk about why we need to increase density in areas.
Yeah.
But it also would be very important to make sure that if there's a rationale that this is there.
Right, right.
So thank you very much. This is really useful.
Thank you, guys. Appreciate you.
Okay, next we have the Health Department update.
Good evening.
Good evening.
Thank you.
I'm Denise Bonds. I'm the health director for this area and a resident of Albemarle County, actually. No PowerPoint presentation tonight. It's late, and I'm not going to do death by slides tonight. I am passing out our annual report, which gives you figures for the entire district. It is laid out by the 10 essential services for public health. These are the 10 services that are felt to be best practice and what our accreditation is based upon. There's also a one-pager that I am going to spend a little bit of time talking about that is the numbers for services that we have provided here in the city and sometimes jointly with the county. So this is for our fiscal year. We run on the state fiscal year, so this would have ended June 30th of 2019. And again, we do operate generally as a joint health department in the city and the county, although money is funneled separately from both of those. So a big update that many of you may have been aware on and served on is that the 2019 Community Health Assessment is out. I am not going to talk about that because that was a joint community effort, and I don't want to steal their thunder. They're going to come and do an update on the health of the community and the priorities for the area and what are planned. It was done with an equity lens, following up on the previous presentations, and there is actually a fairly nice synopsis of history of the area for the entire district. And that's available on our website. So one area that we often get asked about and that people think about all the time with public health is follow-up of communicable diseases. These are the reportable conditions that are required either by the federal government or by our state government to be reported so that we can keep track of how the health of the community is operating. We had 176 reported cases this last year. Additionally, an initiative that the whole state has been participating in is the distribution of naloxone, also called Narcan. This is the opioid reducer. This is free at any health department. You can show up, we'll do a just-in-time training, and dispense it, and you'll walk out. In Charlottesville, we've distributed 244 boxes of Narcan. So
Outstanding.
it's, again, we encourage everyone to carry it. It's free, as I said, and it's a really easy way. There's really no harm if you administer it to someone who's not suffering from an opioid overdose, and it could be a lifesaver for an individual. So something that we're really excited about. We partner with Region 10 on that with Revive trainings as well. We do continue to provide some clinical services at the health department, not a tremendous amount any longer, because really, particularly with the expansion of Medicaid, the hope is that everybody has health insurance and has a primary care physician. But we are mandated by law to provide immunizations, and that includes both school immunizations as well as flu shots. We do a large number of flu vaccination clinics every year, and we do travel vaccines. So if you're taking a trip overseas and you need a vaccination for travel, you can come to the health department and we'll provide it. I'll give you the caveat. The one exception right now is yellow fever, and that's because there are only 2 places in the state of Virginia that you can get yellow fever, because they're currently revamping the production facility, and we're not one of those 2. But we can clue you in where to get it at. We are a Title X provider. That means that we can provide free family planning services, and we provide a full range of birth control, from condoms to pills to long-acting reversible contraception such as IUDs. We had just under 500 family planning clients in the health department here this last year. We work with the refugee community. Were the first medical stop when they arrive in this country, and we saw 144 refugees that got their initial screening at the health department in the last year. A service that we have really expanded over the last year is our sexual health service, and I'd like to thank Mayor Walker for her assistance on some of her Facebook. We have really focused on this area because nationally we're seeing, and locally, an increase in the rates of STIs, sexually transmitted infections. We have served just under 1,000 sexual health clients in the last year, and we have gotten funding to expand our services so that we now offer twice a month at our Charlottesville office free STI testing. You can walk in. It's on the first and third Mondays of the month. I'm just checking. And it's a drop-in. We try and make it a fun atmosphere so that people aren't intimidated by coming in. And we do feel like we're really reaching the right clients because we are seeing a fair high positivity rate, which then we offer treatment to. We have distributed over 100,000 condoms in Charlottesville alone to community members and different partners in the area. Again, that's something that anybody can walk into any health department and walk out with a large bag of condoms free of cost at any time. And we offer a huge array of sizes, colors, flavors, you name it, we got it. There are other local distribution sites if coming to the Rose Hill Drive site is not convenient, of course. We are still a regulatory agency. We offer a large number of environmental health services, and these are all mandated by law. We do provide vital records, and so I think for your constituents, it's good to know that not only do we do death certificates, but you can get birth certificates at the health department rather than go to DMV, who are a lovely group, but often very crowded. You can come to the health department and we can provide that as well, as long as you're born in the state of Virginia. We do inspect all the restaurants in the area. We are a large food town, as you're all aware, and so we work closely with our restaurant owners and chefs to make sure that all of the establishments are safe for both our residents and individuals visiting the Charlottesville area. As part of that, we inspect temporary events. So anytime there's a temporary event in the area that involves food, we've been involved in making sure that the food delivery is safe and complies with the laws. This last year, we did just under 300 temporary event vendors and 60 different temporary events in the area, so quite a large number. We have stuff going on all the time in this town. Finally, in the rabies in the environmental health area, we do investigate rabies cases, and so that is anytime someone suffers a bite from an animal or has an exposure, we will either send the animal off for testing, or we will help the individual go through post-exposure prophylaxis, which is a really painless 4 shots as opposed to the old way. So I do want to just let you know about a couple of areas that we see and have gotten public concern, but don't currently have the mandates to really do a lot in this area. Probably one that is most common is nuisance complaints in rental homes. We get calls all the time from people who are renting homes where they're seeing black mold, they're seeing rodent infestations, insect infestations, and we don't have any legal tools to go out and either conduct inspections in those areas or to work with the tenants to get redress from landlords. That would have to be enacted at a local level to give us that authority, and it would have to be with some from the building planning area. But we just got another email today from a citizen of the community saying that there were rodents everywhere, and she was told to call the health department, and we're like, well, we're so sorry, but try legal aid. So we would certainly be happy to entertain conversations about what that might look like. That would, of course, require resources because we get so many calls. I don't have any additional environmental health inspectors, and they actually would like to get some additional training before they embark upon that. But that is an option that the health department could take on.
Mr. Blair, is that something that we can enact locally, or?
I do not think right now that you could.
Okay.
I think that would need to go in your legislative package.
Okay.
I'd just like to add, though, that there was at one point in the past where we had, it's particularly in the alleys in the downtown area, there were rats, but because that was part of the public park system, our Parks and Rec department did handle that.
That is correct.
So I guess this is one of those. It's
If
not,
it's part of the public park.
but
Right.
but this isn't public park. But this would be an enforcement of. Isn't there some sort of kind of code requirements with people that are renting apartment buildings?
And it's really bad. I received, not to throw your presentation
No,
off,
it's
but I received a call for one of the low-income housing units that were not in the city. But when I sent them through the proper channels, it wasn't, they ended up just not moving into their apartment. But the description of what they saw walking in, and this is not, you're already living there, this is what somebody think you should move into, and that's happening in the city and, the county and other areas too.
And some of that is, and again, you're talking about private property.
Right.
Some of that is taken care of through the Landlord-Tenant Act and habitability of the property itself. But in terms of it passing a local ordinance, I don't think the state gives localities that authority. It's more the private right of action through the Landlord-Tenant Act, specifically habitability of the structure itself.
So instead of being able to enact the legislation, right now the possible solution could be
Information.
information, and then if like you said, legal aid, there would be an increase in, if the information was provided, then the assistance for them to.
But we can do inspections on any company that has a license. So if I know this is an issue that comes up because for certain size landlords, apartment buildings, they have to get a city license, and that gives us the authority to do inspections in order to make sure that there's habitability. Because this came up because there's like a smaller group of property owners that are just under a threshold that we can't even inspect because they don't even have to have a business license. So, I mean, there's got to be some way here to be able to get into, at least for the larger landlords,
Into
like apartment
larger
buildings that have a
apartment
business license, because we
complexes.
issue a license to do business.
Well, well, we can look into that,
Yeah.
but I don't know that the business license would give you the authority to make that inspection for
Well, this would be
issues
something worth
related to
looking into because this
habitability.
came up
So-
about the conditions of apartments that are really deteriorating. And,
So we get a number of calls. If it would be helpful, I can reach out to other health directors
Yeah.
across the state
Yeah.
and see how other localities have handled this, to see what ordinances,
that would be fantastic.
and if there's any model legislation out there, and how they've managed to handle it. Two other areas that I just want to make you aware of. Again, this is all in the realm of environmental health. One is tattoo parlors. Although tattoo parlors, if you're an operator, you have to pass a licensure. There is no inspection in this locality of the tattoo parlor. That is something that you can enact legislation which would allow us to go in and make sure that the facilities, I have not received any complaints about our current existing ones. I have received complaints about illegally operating tattoo parlors. That is, they're not licensed at all, outside of the city limits. But at the moment, again, I don't have any authority to do anything about that. And then the final one is swimming pools. We have sort of this very weird relationship about swimming pools. If we permit them for something else, then we can inspect the swimming pools. So we permit hotels, so we can inspect and oversee a swimming pool in a hotel facility, and the same with a campground. But if it's a communal pool that we would not otherwise permit, we have very limited authority. So we do get complaints periodically, and I will say that all of the pool owners and operators in the area have been very cooperative with us, and we've been able to work with them to try and get any complaints resolved, but it's really by goodwill at this point in time. So those are just three areas that have come up on the regulatory area over the last year. I'd be happy to answer any questions that you might have, and of course, I'm always happy to come and talk about particular health topics if there's interest.
Well, I don't want to belabor the point because for the sake of time, but I've been in different parts of the country talking about this, or just doing research and whatnot, and we've spoken about it in some regards, needle exchange.
Yes.
And I know we've had some reports, but I'm still a strong advocate that I think in our area specifically, we need to look at the possibility of doing free needle exchange. We even had some very passionate testimony or individuals come and speak during public comment, and I think it's needed.
Right. So at the moment, needle exchange is a pilot program in the state of Virginia, and the code says that it can only be enacted in those communities that meet certain criteria that were set out by VDH,
Richmond,
the Virginia Department of
right.
Health.
And they haven't changed, because I
and they
remember you
haven't
going
changed,
through that.
And we're still not an eligible community. We would be happy to start that process once we become an eligible community. It is to be joint agreement by government, by local police or sheriff's department, law enforcement, the health department, and then you have to be able to show that you've got all the wraparound services that are associated with it. So it's a pretty lengthy process. It's taken most communities a good 6 months to a year to get everybody on board, but until that approval comes through, it's just not possible.
So I'm wondering in that regard, if we were to begin the process of just kind of getting everybody at the table and then maybe writing a letter of sorts or sending some information accompanied with data to VADHEC. Did I say that right?
VDH, but.
VDH, yeah.
Right, and I have spoken to the people who make up and said that, I think our community would be very amenable to operating a needle exchange program, a harm reduction program.
And their response is what?
And they have agreed that they would love to look at the formula again, but I think they feel at this point in time that the law is pretty specific about how that can be rolled out. Now, it was a pilot program, and I believe it's up for review again in 2020. And so if it's moved off the pilot to anybody in the state of Virginia, any community can have that, then we would have that option starting next year. So
that's why I think it would behoove us to be proactive in terms of getting the players at the table now to start that process.
Okay.
But
I can certainly send you an email
Yeah, I would
that
love to
has
work with you in
all
that
of the requirements that we have to get, and we can begin those conversations, but with the caveat that until it gets switched.
Right.
So, but absolutely.
Thank you.
And which, locality closest to us has a needle exchange? Do you-
Richmond has an operating harm reduction and needle exchange unit, and then there are two in sort of the far southwest area, and I believe Roanoke is trying to get one up and running at this point in time.
It is up and running.
Is it up and running now?
In the city.
There was a lot, that took a
Yeah.
very, very long time to get that one approved.
The community wasn't so excited about it.
Yeah, there was a lot of discussion about that one. So, even once you get it up and running, what experience with those few sites has shown is that it really takes a long time for trust to build in the community. Individuals want to know that this is not just a sting operation to figure out who's using, that there really is a safe place where people can come. And you have to structure it in such a way that it provides not just clean needles, but it really provides the whole supportive services. What else can we help you with? And that would be our intent, certainly, going forward.
Okay.
Thank you.
Thank you.
Absolutely. All right, thank you so much.
Thanks for waiting.
2 more items. Let's go.
Oh, the map to health?
Yes.
The booklets, do you know when we're gonna get the?
They are at the printers.
Okay.
You want the big, the
Printed
hard copy?
copy,
It's online right now, so you can
Yeah,
certainly go
no,
and look
it's
in it.
at
But
the-
we have an order out at the printers, and as soon as it gets back, we'll make sure that you get your hard copies of the whole volume.
Yeah, I'd asked before, because it just,
Yeah.
with the amount of data in there, it just helps me to have the book.
Absolutely. And I think we're just waiting to get it back from the state printers. So,
Okay, thank you.
Okay?
All right, so.
Do you need the 11 o'clock?
Oh,
The 11 o'clock.
What were we?
Yeah.
So I guess I'm moving that we're going
Till
till 1,
midnight.
I mean, at this rate.
At least till midnight.
Second.
Please
All in
vote.
favor?
Yep.
Till midnight, is what you said?
I said 1
she said
a.m.
1.
Well, wait a second. I don't agree with that.
Okay, well, we have 3,
Is it-
so.
What you-
I thought it was midnight, it doesn't matter.
Yeah, we said midnight. What was the,
She said 1.
was that the actual,
But we may not be here till 1, she just did it, so we wouldn't have to do this again. We're wasting time.
did you say 1?
I did.
That was the motion, okay. Then I'm voting against that.
All right. So Kathy, did you vote?
I thought I did. Yeah, I did, and he said yes.
It's West.
Wes?
Wes didn't vote.
I did.
What is happening?
I did.
Okay, 4-1. Thank you. Hi.
Hi, my name is Amanda Ponce. I'm here tonight to talk about our scooter program, Dockless Mobility. Thank you for, allowing us to push through and here to. It's okay. I'm here tonight to request your support for an ordinance that establishes a permit program for shared dockless mobility devices, so scooters or electric bikes, and revisions to city code that clarify how and where scooters can operate. When we requested your support for the pilot program last year, we were trying to get ahead of the trend and sort of anticipated that we'd be evaluating whether or not scooters would be appropriate for the city's transportation context. But in light of the 2019 General Assembly actions, we're kind of having to reframe the question and ask, how can the scooters fit within the city's transportation context? So, as you know, overall ridership and utilization of the electric scooters have surpassed our expectations and appear to be fulfilling a need for short distance trips. However, as many of the earlier commenters mentioned tonight, they have introduced some new challenges to the sidewalk and roadway environment that need to be addressed with the permanent program. So rather than recapping our presentation from June, where we had a lot of data about the results of the pilot program and what we've heard, we just wanted to provide this quick highlight that handout that's also shown on the screen that gives you some of the highlights of that data. And I want to thank Cole Songer and our city's IT department for doing all the analysis with all of the data that we have. It really has been very insightful. So I do want to focus tonight on the implications of the state legislation and staff's recommendation in response to our experience over the last year. So in March, House Bill 2752 was passed, which gives localities the authority to establish regulations regarding e-scooters and e-bicycles. However, the new law now allows the companies to operate free from regulations starting January 1st, 2020, in the absence of any local ordinance or administrative action. In addition, revisions to the state code now allow the operation of scooters on motor vehicle travel lanes on local streets, as well as sidewalks and trails. And unless local ordinances with different rules are adopted beforehand on January 1st, 2020, scooters will be allowed unrestricted access to sidewalks under state law.
Good grief.
So, as a result of these changes and the results of the pilot, staff is recommending that council adopt an ordinance permitting scooters to operate in the city. Given the level of ridership, you see 250,000 plus rides during the year that it's been in operation. We believe that our current operators will want to continue operating in the city and will want to request some additional devices or increase the number of the devices that are currently here in the city. The proposed ordinance before you provides a framework for a permit program that would allow the city manager to create regulations, fees, and set a fleet cap that is appropriate for our community. We're also recommending changes to the existing city code that clarify equipment requirements, where and how wheeled users can ride and where they can park, and specifically prohibit e-scooters and e-bicycles from riding on the sidewalks and setting fines for violations. In addition to the ordinance changes, staff also recommends an ongoing commitment to expanding our network of bicycle and pedestrian infrastructure. The only way we're going to be able to achieve our goals of reducing congestion and reliance on single occupancy vehicles is by providing safe and comfortable alternatives to driving. Lastly, staff recommends hiring a full-time staff person using the fees collected from the program revenues to work with companies to ensure compliance, provide additional inspections and enforcement, implement an outreach campaign which will help, provide the knowledge to people to how to use these devices, and ongoing evaluation consistent with the comprehensive plan goals. We also have a vision that this person would work across jurisdictional boundaries, namely the University of Virginia, since many of the rides and parking is happening on grounds. So we'd like to be able to get that person in place and on board. With that, I'd like to answer any questions that you have and invite Jason to come up and help answer whatever questions you might have.
Okay.
First, I just want to say, I read through all this over the weekend, and I just really appreciate the thoughtfulness that went into, really laying out the concerns that we all are hearing and then addressing them point by point. So thank you so much for the work and laying that out. I am just really still curious why, and I said this to Mr. Blair earlier, the county is just not wanting to just leverage all the work we've done. And we've said it to them in meetings before, because scooters seem to be a really popular topic with both the county and the university. So I'm just struggling with, what kind of exposure that, you just saying the statement, I hadn't really thought about that they could just ride on sidewalks without any kind of repercussion. Some people think we already have that problem here, but I'm just struggling to understand why, as a region, we're not looking at this more holistically. So I'm hopeful that maybe they will reconsider that, even just to make sure that there is something in place in this time frame.
And I just had a question off of that question about, I know one of the requests was to potentially take the fees and hire someone that would look at a regional plan, but my question was, how do you all plan to do that without their participation, and shouldn't they, because we talked about where the scooters end up, right? So we would essentially be doing the work and funding it for both localities when their residents are benefiting too.
Yeah, I mean, I think that's a good point. I think the data that we have does show that there are some trips that are going into the county, starting and stopping, but it is still a small percentage, only I think like 1 to 3% of trips, so it is fairly small. I think the city-university relationship is really important, and, you know, I think at a staff level, we've all worked really well together and sort of shared our experiences, and so, you know, that opportunity could be there in the future, but I think really for it to be successful, we do have to work together regionally.
But I think Vice Mayor Hill wasn't finished with our question.
I just think that the most important thing, and Councilor Galvin, I talked about this before, is for us to really be emphasizing that this is what, like you said here, like, initially this was to decide whether we were going to do this or not, and now it's a must. And like we even got some communication about that today. So what are ways that we can immediately, because we're going to pass something today, really get out? You're working with our communications team just to really get that message across that I think it's really been lost on some people that we aren't no longer in this pilot mode because we're going to determine if we're going to accept them.
Right.
But we really want to explain we are going to do it, but we want to have the communities in buy-in because at this point we are setting this ordinance, but we will have the flexibility to enhance it further as time goes on and lessons are further learned.
Yeah.
Okay.
Yes, I think that's one of the values of having the permit structure in place and more administrative ability to make those changes, kind of, I think that's a real benefit there. I think as far as communication, we've got good relationships with the providers and can get in-app messages out fairly quickly. I think certainly working with our communications team and the social media platforms that we have, I think is really important. I think one of the things that we learned from the survey was that, you know, most people are learning about the rules via the app, not necessarily via city website or city press release. You know, they're getting it from their phone, and so finding ways to kind of connect with them. The other thing we've done sort of more recently, and it's still being rolled out, are some hang tags that are being placed on the devices themselves that say what you can and can't do.
I saw those.
So you may have seen some of them, but they're still being rolled out.
So I have a question in terms of, so I've been on the sidewalk when they've come by, right? And I think it's safer for them to be on the sidewalk than on the street based on how our streets are set up. So that was one of the things that was alarming for me. That didn't present a problem. I've also moved one, you know, out of the way, and you know, so, and that wasn't a hard process. So part of what, when reading through this report about the complaints and where, and I think was it 220 complaints from 90 people, was that what it was? That didn't seem like, I mean, I know it's not for staff, but in terms of overall, based on the number of rides, that didn't seem like, you know, a lot in terms of, and I'm just wondering, they're not big, you can step over. I understand if somebody's out like a stroller or something like that, but I understand the education piece, but the $50, and especially where the company is not being held liable. I know in the report it says something about the geotechnology you all thought was stronger than it is. And so if that was presented from the company, shouldn't they be more responsible than the citizens in terms of the fee attached to it? Because I think $50 fee could add up for someone who may think, and I don't know what these stations look like, or if they were just, you know, finished riding. I mean, I've seen them on corners, I've seen them sitting up on sidewalks, and I've seen them there. And then you go by a few days and they're still there. So I understand what you are saying, but it just seems like that amount was pretty.
That's the fee that's established in the state code, so we're just following that amount. I think, you know, for people who have disabilities and are trying to navigate the sidewalks and who are affected by a sidewalk or a scooter laying in the sidewalk, they might say that a $50 fee is not nearly enough. So I think there's...
Yeah, but I don't think, as most of these complaints based on disability, because even the women who, one of the women who spoke today, I mean, sometimes it's just about inconvenience, which I understand, but I still think in terms of when you're rolling something out and going through phasing of it, does the state mandate that it has to be $50, or does the locality? And then is there anything in terms of the company that you can do to penalize them versus because if they say you shouldn't be able to take the bike here, that was one of our conversations with the county, right, Heather? Like how far the equipment could go and when did it stop, and that wasn't working. So if they're not doing their part, can they be more responsible than citizens? And not saying not to hold citizens responsible, but just looking at that.
Yeah, to go back to your first question about the complaints we've received, most of them have just been people just not liking scooters. They'll send in MySeville complaints with pictures, and I think the vast majority are just people that just don't like seeing them.
Yeah.
We do get the ones that are blocking and obstructing walkways, but the vast majority they're just there. People don't like them. I think the problem with the fees is, one, the enforcement piece of it is going to be a challenge, but then also treating bikes the same way, especially on the downtown mall, and then figuring out the balance between who is responsible, because once you sign in, you're responsible for the device, and once you sign out, you're not responsible for it anymore. So figuring out where that lies and who's doing what with scooters.
So they were supposed to have these pickup, and they were employing local people to pick them up and charge them. And people were having difficulty getting the charging stations, having the time to charge them and get them back out. So I know people who because I talked to people about this process, who didn't think that it was worth the amount that they would be paid for the amount of work that it ultimately took.
And Lime has changed their operating model where they have stopped using the juicers, just people that would go pick them up, and they have essentially vans to go pick them up and charge them in the back of the vans.
Okay.
VO Ride has swappable batteries that they could just swap out with just a staff person. So the labor structure has changed.
It's
for both
changing,
companies.
okay.
I have, Madam Mayor, I have one question, which is whether if there's a compromise on the sidewalk issue, if you could, and this would be a question I think for Mr. Blair or whoever, if there's a way of saying, I agree with what Mayor Walker said, which is it seems too absolute to prohibit them on sidewalks. Absolutely. It seems like you could have a rule or a principle of some sort for their operation, like kind of how you guys have structured the parking. So you would say you must be parked in this way. So you may not ride, if a vehicle is on a sidewalk, it must be conducted in such a way that could not cause reasonable apprehension from somebody walking the sidewalk or present on the sidewalk, something like that. So that if a cop, you'd have something enforceable. So if they saw somebody endangering somebody or riding too close, like some of these other rules, but it does seem too absolute. Like if you're on, going on some street where there's not, the bike lanes here are not very safe anyway, and it feels to me like a scooter could be more exposed in a way than a bike. And if there's nobody on the sidewalk, and like I've I don't know if I should admit this here, but like I've ridden on like there are sometimes on hydraulic road when I've ridden on my bike on the sidewalk, because it's just like it's not safe for me to be on the road, so I'll just do it for a short time. So anyway, I think if we could craft something which would have
So if there is no bike lane.
maybe but I'm not even sure about that. I would prefer. You could write a rule that would have compound.
So if there is no bike lane,
contingencies,
that's when a bike can be on a sidewalk.
Maybe you would say something like that, but to me, you could still have, if it's dark, if they could be on a sidewalk as long as it was not unsafe for somebody who was on the sidewalk.
Well, there was something in here about from sunset to sunrise, right?
That was for the lighting.
Yeah, this doesn't say
Yeah.
it. I don't know, I'd be interested,
Was that in this report, or did I? Okay.
Yeah.
I just wanted-
Yeah, to piggyback on that, the Bicycle and Pedestrian Advisory Committee met after this report was due to kind of talk about this issue, and there wasn't a clear-cut consensus on which should be promoted. I think there were some that felt like riding a bike or an e-scooter on a sidewalk was a good thing in places like, where there's no bike lane or where the speed of traffic is very fast, but others felt like, the sidewalk is a pedestrian area and it should be kept clear and free for pedestrians. So there wasn't clear consensus there.
That's tough.
And we can amend this, though, moving on. Right now, the main thing is to have this in place before January 2020.
Right, and we're just doing a first reading today.
Right.
But even the That was a question that I had about, you have cars going through the mall in 2 spaces, but then people can't ride a scooter
On the mall.
on it.
They could cross
They-
the mall
they
on
can
those
use the
vehicular
crosswalk.
crossings.
Well, I understand, but
Yeah.
it still was hard for me to ride. A lot of kids spend some time on the mall. I didn't understand if they wanted to zip to Christians, but I'm very flexible in areas like this, so it's gonna be hard for me to wrap my head around that we could, I understand there's only 2 points, but how much, I just don't get it.
That why we can't let kids ride their bikes on the mall? What are you saying you don't? Or ride scooters
Well,
on
we
the mall?
weren't asking, we're just having a conversation. I'm just saying, in my world, it makes sense.
I'm
that
just
if
trying to
somebody-
understand. Is that what she's saying?
Being so restrictive. I'm not that restrictive. I will never be that restrictive, and that's what I'm saying. Someone on a scooter going down the mall, people.
No.
I'm
I'm going to be that restrictive. My 3-year-old will get creamed. No thanks.
No, they,
But I mean, where does the responsibility come in also people being able to move out the way? Like, you don't
But
know
they
when
come up to
someone's
them.
coming.
But I don't know if for the sake of the discussion tonight.
Yeah,
that
I-
that's.
Yeah, no,
that
I
we're
understand.
going
I'm
down a
just-
rabbit
I think
hole. Miss 11,
I'm willing to say
55,
that
and I
this
miss my
ordinance
baby.
is actually quite complete.
It's really, really.
And it's thorough, and I'm willing to pass these ordinances as written.
Right, me too.
With the understanding that you're going to be putting forward a recommendation for funding for a position to have the enforcement. I think enforcement is critical. I think there has to be a penalty for breaking these rules, because it's too dangerous.
And right now, what was proposed is that you feel that we have this could be self-sustaining. I mean, in terms of the funding
Yes.
that's raised by this program
Yes.
would allow that, and I'm in total support of that.
Well, I know it's late, but we still can provide input when things are submitted to us.
I'm just saying that I think this is, I'm ready to vote on this.
We don't have to vote
Well,
on
it
it.
wouldn't be a vote tonight.
It wouldn't be,
It
but I'm
would
ready
be
to
put
pass
it on the consent agenda, if you wish.
So I had another question about the permitting fees and what the structure would be moving forward to fund the position that you all were requesting, because it looked like it was just a little bit over what you all are utilizing now in the total budget.
So we're still working on what those exact fees are and trying to work it into what is the, appropriate fleet capacity, as well as, how we could structure it so that we could fund that. We currently have collected $68,000 approximately from the fees for this year. So that is available potentially to carry over for next year.
So in terms of the potential staff member and salary, this is a FTE position, or like looking at that?
I think with the responsibilities of it, it'll be a full-time position. I know that we've talked about part-time, but I think it'll be more full-time because of the enforcement, as well as looking at regional, the regional piece of it. I think it would be full-time, but as always, I want to make sure that our revenues cover the expenditures, so we have to look at that in terms of, the permit fees and how much we're going to charge them per day for the devices, so that we cover our costs.
So are we at the max for what we can charge the companies?
The fee that we're charging the companies currently is $1 per day, which was something that was floated to us initially. I think that fee structure is very different now when you look at what other people are doing. So I don't think it's realistic that we would charge $1 per day per device moving forward. But
And one more question. So
You're doing this on purpose.
no, I'm really not. I read this. You see it marked up, all of that?
I just want to have that debate about the downtown mall.
Cut it out.
But
I'm going to move that we're here until 3.
but seriously, like the helmet, if the purpose of these scooters, since we're talking about not having this discussion, Dr. Bellamy, where do you think someone who's like, oh, let me hop on a scooter and ride 3 blocks, where are they going to put, this is not a cartoon, right? Where are they going to pull the helmet out from? Their pocket?
I like the proposal as presented.
Okay.
I would just float having done some crack research here on different states where, so that permitted on the sidewalk in Texas and DC and a couple of places not permitted in California. And there is a compromise, which Council Galvin said, which is if there's a bike lane available, then you're not allowed on the sidewalk. And I would think that would, it feels to me like it would be unenforceable and easy to scoff at if it was blanket prohibition on all sidewalks. And if we had some
And I would
softening
even,
of
I would
it.
say that Austin and, what was the other city you mentioned?
Texas
Te-
and DC.
No, and DC, those are much wider sidewalks, much wider sidewalks. We have 5-foot sidewalks
Sure.
that are being buckled by rising tree roots, and they've got telephone poles and transformer units, and their clearance is usually about 3 feet. Our sidewalks are not the same as some of these other cities, and that kind of infrastructure is really, really important to get right.
would
So
you
I
support it?
just, I really don't think our sidewalks, the way they are right now, can be, you can put motorized vehicles on them. When we get newer streets put in with clearer, like the new West Main Street, yeah, there'll be a 11-foot, 12-foot wide clearance on those sidewalks, but not. So maybe you could put a dimension on the sidewalk, but then that gets to be
There's no way to do that. That's
a real, but they're really, the sidewalks in this city are really, really not.
But how many reports have
Accommodating.
we received about someone getting run over on a sidewalk by a scooter?
We don't have any police reports about that. The data that we have on crashes is coming from the emergency department, and we don't have the details of the incidents. So, to our knowledge,
I mean, we've received a fair number of pedestrian scooter conflicts. Most of them have to do with the sidewalk. So, I mean, I think that's out there. I think people are going to ride where they're comfortable. That's the main thing.
So I would make that motion to change this so that you're allowed, but if there's not a second, that you're allowed, that we would amend this to allow bike riding on the sidewalk if a bike lane is unavailable. Is there a second? If there's not, then.
I would
it
support
doesn't.
that. With-
Okay.
There's two of
Okay.
you.
Second.
But I can't agree with that.
I can't
Okay,
either.
okay, but then, so there's a second, so can we?
Yeah.
So I've already made the arguments for it. I'm gonna call a vote for it. I don't know where Wes is.
Well, this would just be to vote to ask staff to amend it for the consent
Consent agenda,
agenda.
right.
Yeah.
Wes, where are you on it?
I like it as it is.
Okay, so vote.
Okay. So we'll put it as presented on the consent agenda.
So one more point I want to make is about the $50 penalty. You also have in that you would want the full-time staff member to focus on low-income ridership, and a $50 penalty to low-income citizens who may be in violation could be a significant amount of money, Dr. Bellamy. So I just would also like for us to look at that. How it's going to be enforced, how often are there going to be any warnings? I know somewhere in here said that, you know, based on the data you receive or being able to connect with the cell phones or send the messages, so maybe you know who it is, but it could be a significant amount.
something we can look into.
Okay. So I don't support it, moving towards the consent agenda, so just, but thank you all. It was a
Thank you
good
very much.
report.
Thank you.
Thank
Thank you.
So it's going to be a regular agenda item? I'm just confused. Are you going to pull
So
it?
next we have the,
Do we know? I'm confused. Is that going to be a regular agenda item?
I don't know where.
It's gonna be on the consent
Consent
agenda.
agenda.
I'm just saying I don't support it, so I'm gonna pull it, and I'm just
Oh,
thinking that
vote
we.
separately? Okay,
Yeah.
we'll put it on the
Separately.
consent agenda,
Okay.
please.
So next we have 209 Maury Avenue and resolution for the comprehensive plan future land use amendment and the rezoning request.
Mayor, City Council, Matt Alfleet, City Planner, Neighborhood Development Services. So before you tonight, you have a request for rezoning and amendment to the 2013 Comprehensive General Land Use Map The comprehensive plan amendment is a resolution, will require one reading. The rezoning classification change is an ordinance and would require 2 readings. So landowner, Southern Properties LLC, which recently sold the property to FMC Investments LLC, which is also part of Southern Development, so kind of an LLC within the same company, submitted an application seeking a rezoning of approximately 1.6 acres of land identified on city tax record as tax map parcels 17-18, 17-18.1, 17-18.2, 17-8-184, and 17-185, and 17-186. The subject property, which has the address of 209 Maury Avenue. The subject property has frontage on Maury Avenue and Stadium Road. The applicant is proposing to change the current zoning of the subject property from R2U, two-family university, to R3 multifamily with proffered conditions. Comprehensive land use map for this area calls for low-density residential, which is up to 15 dwelling units per acre. The Planning Commission recommended to City Council to amend the 2013 Comprehensive General Land Use Plan if the subject property is rezoned from R2 to R3. The new zoning would no longer be conform to the existing land use map. Under the current map, the subject property is low-density residential, a designation not consistent with R3 zoning. A high-density residential designation for the area is more consistent with R3 zoning. A little background: on July 11, June 11, 2019, the Planning Commission provided a recommendation to City Council to rezone the subject property of a vote of 4-2. At the following meeting in July, the Planning Commission provided a recommendation to City Council to amend the 2013 general land use map from low density to high density residential with a vote of 5-2. In August, the August City Council meeting, the applicant presented new documentations, proffered conditions, and a conceptual layout that affected the rezoning application. City Council moved to send the rezoning request and comprehensive plan amendment back to Planning Commission to review the updated materials. The June 11th and July 9th submittals, the applicant was doing a straight rezoning with no proffers, no development plan, just requesting to go from R2U to R3. The new material, the applicant has provided a proffered conditions, conceptual drawings, and I'll go into the kind of the proffered conditions here in a minute. But at the October 8th Planning Commission, City Council and Planning Commission held a joint work session, and there was some concerns raised about the existing home and protecting the Eugene Bradbury designed home. Rezoning the subject property from R3 to an R3 density could be an increase to providing more housing closer to the university. The Planning Commission also initiated a comprehensive plan land use map amendment to change the subject property to high density residential from low density. There was also concern with some of the by right uses within R3 that are currently not allowed in the R2, such as bed and breakfast and public health clinic. During the meeting, the applicant presented an updated proffer statement to add an affordable housing requirement. After hearing the Commission's concern, the applicant orally amended the proffer statement per section 34-64B. The updated proffer statement removes the words "to be constructed" from number 5A111, and number 6 was added to remove some by right uses. 6 members of the public spoke during the public hearing. Some of those concerns were frustration that the applicant submitted an updated proffer statement during the meeting. Also concerns that any change to the zoning would undermine the neighborhood, which is a stable neighborhood. Staff would recommend that during your discussion, keep in mind that the graphic information provided by the applicant is not a site plan, but is there for added information. The proffers provided by the applicant in the underlying R3 code sections are the regulating entities for any proposed development on the site. And I quickly just want to touch on some of the highlights in the proffer statement. As again, before, when this came before y'all before, there was no proffer statement whatsoever. So the main proffers in here are related to a proposed layout which would control where buildings are located, where the ingress egress is located, that nothing would block the existing manor house. Also that the manor house would be preserved, that no changes could happen to it. And then also the affordable component of any development. And that proffer talks about that prior to issuance of a building permit for the construction of any new buildings within the subject property, the landowner will demonstrate that he has provided for construction of affordable dwelling units, ADUs, by one of the following means. One would be for rent ADUs will be constructed by the landowner on the subject property as part of the landowner's development of the subject property. The gross square footage for the affordable units would be 15% of the aggregate habitable floor area for the building on the subject property. And then for rent ADUs shall meet the definition of affordable dwelling units in the City Code 3412C, where we outline what affordable units are. If the applicant chose to do for sale ADUs, they need to be under construction by the landowner at a site outside the subject property at a location within the city of Charlottesville. If the landowner constructs the ADUs, then the for sale ADUs shall meet the definitions of affordable dwelling units as outlined in City Code 3412C. The number of ADUs shall be 15% of the total number of dwelling units within the subject property. At the landowner's option, if the landowner conveys to Habitat for Humanity by record deed any off-site lots for construction of off-site ADUs pursuant to this proffers, then if any ADUs are so conveyed to Habitat, they must, one, either be the ADUs on such off-site locations shall be deemed to be under construction as the date of the recordation of the deed of conveyance. And then the landowner shall provide to the city with a binding commitment from Habitat for Humanity promising that if any of the individual owners of the ADUs for the on the off-site location sell or otherwise transfer ownership of the affordable dwelling units to a person other than a Habitat for Humanity organization or qualifying heir within the first 20 years following the issuance of a CO, certificate of occupancy, for the unit sold or transferred, then Habitat will use any profit-sharing proceeds from the sale to transfer or replace affordable dwelling units within the city of Charlottesville. And then the last proffer has to do with removing some of the R3 uses that the Planning Commission was not comfortable with, such as bed and breakfast, homestay, and health clinics. I know it kind of went along, it's kind of late. The applicant is here, can present more information. I can answer any questions.
So how many units are going to be built on this site?
So there's not a site plan, so there's not, they could go by the by right, which right now, if it went to R3, you're looking at I believe 21, so your by right density right now is up to 21 DUA, and you're 1.6, so 33 units by right, so 15%.
And can you please go over a little bit more detail why this is not a site plan?
So because it was not put together by an engineer.
It's not
does not
engineered.
reach all criteria we would review at a site plan.
And so how much sway does this hold when when a site plan is submitted?
So, and that's one thing I would have city council think about as you're going over this. There's some illustrative documents that are in here that I think are helpful, but what I would really concentrate on is there's only one document, and that's what's tied to the proffer statement. And that is the drawing here that gives the general layout, locations of the buildings, again, where the ingress, egress points are to it. And so this is the only sheet that's proffered. So when they would submit a site plan, the location of the buildings, where their ingress, egress points are, general look needs to look like that layout, but it would also need to meet all the site plan requirements. The best example I can give on this is there's a sewer line running through where one of the buildings is at. So that sewer line, to meet the location of the the general locations of the building, they're going to have to relocate that sewer line and easement. Parking was another concern when this drawing was first presented, that the parking was too far forward, that would not meet the parking regulations for where your parking lot needs to be located in R3. So that was adjusted to try to head off that concern, where if this did get approved and then you did come with a site plan and we're looking at a proffered drawing that wouldn't conform to our site plan regulations, we were trying to avoid that.
And we're being given a choice between affordable rental, or affordable home ownership?
The applicant has the choice. So the proffers are written that if they choose to do rental units, there's a mechanism for them to do that. If they choose to do off-site buy, and there's also I did in the proffer, they also can donate to the Affordable Housing Fund like you would in other situations.
And the housing is, as is written, as a partnership with Habitat, and, or
They have that option. I believe the applicant is pursuing a partnership with Habitat, so they wrote that in their proffers if that went through.
But the stipulation in there is what I want, that if it's, 20 years, if they decided to sell within that time frame, they would have to, I guess Habitat would get the first right of refusal for the property, and then,
And they have to, if they sell within 20 years within the CO, that Habitat has to use any profit sharing to construct a replacement affordable dwelling unit in the city.
But there's not a 20-year commitment for the rental unit. I didn't read that.
No.
Nope.
I don't think so.
No, ma'am.
Correct, you are correct.
And then finally, both of them are based on a 15% of the total square footage of the buildings?
The rental is based on a square footage, 15%. The owner is based on number of units, 15% on the number of units.
And we don't know either.
Most likely 33 units, going by the by right.
But we really don't know the square footage.
Correct, until we actually would get further down in a plan review.
Okay, thank you. Thank you.
I've heard this conversation through 2 different planning commission meetings, and we've had this once before, so I really don't have any more questions.
Anybody? Okay, so there's a vote for the comprehensive plan future land use amendment. So there needs to be a motion.
Yep.
So we're a motion for the,
You have to do them separately.
Because one is a no vote.
And the other one would be Well, we'll see how this goes first.
I move that we adopt the resolution for the comprehensive plan future land use amendment
As presented.
as presented.
Second.
Okay. Any further discussion?
I mean, like I said, I've sat through, some of us have sat through these conversations many times. I hear both perspectives of this. I just think this is an area that, as the Planning Commission has said, that in a future comprehensive plan is going to have greater density. And I realize that people want to wait out until that happens, but at this point, I think we're a couple of years out, unfortunately, from that. And I see this as a ripe area for us to get some more density and proximity to the university. And so it's just really, I understand like what is the real need of the community as a whole. And we've heard from some folks that have been really thoughtful in presenting that perspective as well. And it's preserving the manor house, which I consider a really high priority as well, while allowing it to adapt to the needs that we have here. And so that's just where I am. And again, largely weighted by the conversations that I heard our Planning Commission have on this subject more than once.
And I guess, again, why is it, we've been doing rezonings without changing the comp plan for the last, I don't know, decade. What, somehow this is a new best practice, and what, I'm getting hung up on it because it does feel like we're undermining the public process of how you redo your comp plan.
I can shed a little light on that just because of kind of a quirk in our code. So actually in the code, there's only, I believe it's 1 month or 2 months out of the year that someone other than the Planning Commission can initiate a comp plan amendment. And so if that doesn't line up,
oh my God,
you kind of get off where an applicant's submitting a rezoning, but they maybe, they're not within that. I think it's November, December is the only time they could present.
Wow. Okay.
And but the Planning Commission can initiate a comp plan amendment at any time, but a developer only has that 2-month window to do it.
Okay. All right, that's peculiar. But for me, okay, the meat of this is the rezoning right now in terms of the practical matter.
Okay. Any further discussion?
This is just on
But can he do the rezoning without the comp plan change? Or is the comp plan change essential for the rezoning?
No, your rezoning is your regulatory body. Your comp plan is, again, you don't have to be in alignment with your comp plan. Your zoning doesn't have to line up. It's ideal if it does. Typically, when the last time we updated our comp plan, our zoning wasn't in line with it. And that typically, unless you're going to do this citywide rezoning, it takes over time. As an applicant is bringing forth a rezoning, the Planning Commission is looking to see, does it match our future land use? So it doesn't have to match up that way. It's just this came out of, it was a little cleaner because it was residential. It's going from low density residential to a higher density residential. And the disconnect, one of the questions, one of the standards of review is, going for rezoning, does it match your comp plan? And the answer was no. If you were going to go from R2 to R3, no, it's not going to match your comp plan. Your comp plan says low density. So as Planning Commission, as a body, if they thought it was a good change in the rezoning, they had the ability to also initiate the comp plan then to match the rezoning. They didn't have to. It wouldn't have been a real major issue other than it was an easy thing to do along with the rezoning.
Okay. Well, this has been an improvement compared to what was done before. Well, okay, I'm going to probably move forward at least to get to the next phase of the conversation.
All right, please vote. Carries 4-1.
There's more?
Yep.
This is really, really rotten. I hate this. 2 more meetings. This is, I'm sorry, I'm having a meltdown. I'm just so fed up with this rezoning crap. Here we go again.
So this is just, there's a no vote here, so it's just whether we're going to move it forward.
Right.
My position is still the same, that I don't support it.
I'm moving it, I would move it forward.
So this is moving the rezoning forward.
To the consent agenda for the next meeting.
If I may make a comment, this is an improvement from having no drawing at all. And there is a lot of information now. The site plan as a sketch does present a sensitivity to the existing building. What has been odd to me is that across the street it was R3 and then across the street was R2. Good practice is that you'd have like facing like. So in that sense, it would create a better sense of place to have the zoning match what's across the street, provided it's built that way. But we don't even know it's going to get built that way. So yeah, all this is going to, we still have time to vote no, moving forward when it gets to the consent agenda. But I just, the process really is really convoluted. I know we need units. I can rationalize it by thinking that we're building units today for student housing, but when the university gets to the point where it's building housing on site, this will be able to convert to workforce housing, and it is within walking and biking distance of UVA, our major employer. So I see that value. So I'm leaning on supporting it, so I guess just move it forward. But I'm just really, this is just not solving the problem at all.
Because we should be doing all this across the city with all.
It should be across the city.
No, I don't disagree. We're ways away
But
from
even when, again, even when we're doing it in areas that are just more holistically done, we're not changing our zoning either. And we're not changing our dynamics. We're just going piecemeal, developer by developer, letting the developer be the one who's driving our changes.
Okay. Councilor Bellamy, Signer.
Move forward.
All right.
Thanks.
All right.
Thank you, Mr. Alfalay.
Very nice report. Thank you.
All right, next we have the allocation for the Food Equity Initiative Fund, and I'm not sure why this wasn't on the consent agenda. Because we got the report the last meeting.
Don't tell him that now.
I'm here, so
Yeah.
we can.
Thank you for staying so late.
It's okay. We're
But-
all here.
Yeah, so I guess I just have the question, did you all need have any other questions? We got the full report the last meeting.
I mean, I asked my questions already, but, I mean, they have been here for 6 hours waiting, so we're gonna let them have their minutes.
I don't think they're concerned.
We really don't have a present,
Yeah.
We know that a lot of them. So just to recap, the last meeting, or not, a month ago, we presented the strategic action plan as well as our whole process and what we did. There was general consensus around that, and we were asked to come back in support of 2 federal grants that we've gotten and to continue this partnership with the city. And so before you do have a memo in the resolution. And then obviously that whole large packet that was in the October 7th meeting would be a part of this plan. So if there are any more questions.
Madam Mayor, I got a question. This 155,000, this is gonna be just for year 1, right?
Yeah, this year, year two. the food.
So next year you'll come back for 125,000, then another 125,000. Is that the plan, or are you going to try to go out and fundraise for that?
Would you like to?
Sure. Yes, we would come back if the city wants to continue the partnership in that way. I think we are doing other funding. So in the follow-up email, which I don't know if you got, but we're looking at the funding from the grants, funding from foundations, and then funding from the city. So pairing all three of those. The focus on this year and next year would be on really building those city partnerships. We might have a new model by year two, by year three, where the position gets folded into other equity work that the city's doing. So I think that's up in the air. That's why we're just doing it 1 year at a time.
Right, and that was what one of my questions,
Yeah.
aside from the other funding sources that I asked, that Misty responded to, was around the push for this to go into a regular budget cycle, because I think you and I did ask you before, once before, about just looking at our Vibrant Communities funds and like what are other ways that we would do this, just so that we're kind of treating this like we would other initiatives of its type. So is it your intention, like right now we're just deciding with current funds for this current year, and then is the request though to have us fold it into our budget cycle for years 2 and 3 in the regular? I guess that's where I'm getting confusion.
So I think that's up for us to decide in the second year when we see how that relationship is going with the city. So the work will definitely continue into year 2 and 3 in terms of on-the-ground program work. And that work is being funded through other partners, through foundations, through the Vibrant Communities grants. We have proposals into that for some of the actual like nuts and bolts of the grassroots work. This work is about the networking, the community advocate program, the building the relationships with the city, which was initiated first by a city council request to pursue understanding food equity. And so that work is at a city level. So that's why we're coming to this body, because it came from a request from this body. If over the next year that's not appropriate anymore and you want to look at something different, we're very open to meeting whatever.
Okay, so right now it just is for the 155 for this current fiscal year.
Yes.
Okay. And looking at the dollars and cents of this, we were a little shy of the unallocated funds in our equity, or
Your total your total amount that you have now is about 435,000. So if you take the 155 from that, then it goes down from there.
it's just said that there was 284,700 previously dedicated, not spent, which we left. The only 150 was totally unallocated. So I guess we're saying that we're going to take the relatively small balance from something that's already been like loosely allocated, I guess. And then everything will have been tied up. All right,
I'm just saying with your total. Council Strategic Initiatives Fund, that's what you have in total.
Okay.
Well, Mayor Walker, I'd like to make a motion. I'd like to move that council approve the resolution on the allocation of food equity initiative funding for FY 2020 for $155,000.
Second? Is there a second?
Yeah, second.
Okay.
I can't vote.
Please vote. No.
Okay, so we vote?
We vote?
Thank you.
Thank you so much.
I'm really impressed with all of you.
Everything good is worth waiting for.
Yeah.
Thanks, guys.
Any other business? Nope.
Can we have that discussion about spikes in downtown law?
Or maybe we should have it next time. I mean, we'll have an opportunity.
Work session.
Anyone opening the matters by the public? Anyone here wish to speak?
Oh, no. Please.
I just wanted to wish everybody a very happy and safe Thanksgiving holiday.
Oh, thank
Thank
you.
you. Thank you. Wow.
All right, have a good evening.
Happy
Meeting
Thanksgiving.
adjourned.